to 24 hours as we expand across the city.
Was it concerning to you, as it was to us, that there was no funding added to H&H despite the efforts to expand the program?
No, it covers, as I think Dr. Katz mentioned, it covers what we're currently proposing in this coming fiscal year for expansion.
Okay. Some questions just about the state budget. What are some of the major proposals that will impact the system and the city as a whole in both a positive and negative way? You could summarize that.
I'm going to turn to Linda, because one of the fascinating things about the state budget is first, we're still not totally sure, which I think sort of, that in and of itself is kind of interesting, right? And that there were so many pluses and minuses that were in the budget that it's not easy to assess exactly where we come out. Linda?
Thank you. So as Dr. Katz said, we are still assessing the overall impact. There were a number of initiatives, some positive, some negative. There are many where we require additional information from the state to really understand how they will work and what the impact will be. Generally, our largest concern with the budget is that it continues the state takeover of the pharmacy benefit, which results in a reduction in 340B revenues for our facilities. That was implemented as of April 1st of this year. And also, as was mentioned, there was nothing specific in this budget related to DISH, but we do want to emphasize again that we remain concerned about the federal DISH cuts, and those would need to be addressed in state statute to prevent significant reductions to H&H should they occur. We appreciate the continuing support from the council as well as our state leaders on that front. With respect to the details of the budget, in addition to the 340B cut that resulted from the pharmacy takeover, the state implemented a number of items which they say are intended to offset that impact. As mentioned, we are continuing to assess them, and we don't know yet whether they will be sufficient to address that reduction. Included in that was an increase in hospital inpatient rates of 7.5%, a 6.5% increase in hospital outpatient rates, funding for our FQHC clinics, as well as some funding for Ryan White services. The state also implemented an increase in the essential plan rates. The essential plan are the health plans that are available on the New York State of Health Exchange, effectively the Obamacare plans. We have quite a few questions about how that will work and what the resulting impact to our system will be. The other positive aspects of the budget include a $1 billion capital transformation fund. This will be in part dedicated to provide funding for healthcare facility projects for providers and in part to support technology and transformation projects. There is a $1 billion investment in behavioral health services, which includes another significant capital investment for residential unit development, as well as both capital and operating for expansion of inpatient beds. We were very happy that the state reauthorized what we've referred to as the UPL conversion, which is an important supplemental Medicaid funding program that we are pursuing with the state and the federal government. There were a number of service reimbursements revisions that were made that, as said before, we need to really investigate with the state how they will work, but we think there are significant opportunities there that we will continue to explore. We were pleased that the state restored the quality pool for managed care funds, which are important for incentivizing quality care and something that we have benefited from, as well as Metro Plus. And a 4% COLA for human service and behavioral health care workforce. In addition to the 340B cut, on the negative side of the budget, there was a failure to restore a capital cut from prior budget years, so that while the state has invested in capital grants, they are not fully reimbursing facilities for the capital investments that we make on our own. And they also failed to provide, from our perspective, significant or satisfactory funding for safety net hospitals. We had participated in advocating for expanded funds for that group of providers as well as ourselves.
There was a proposal to boost Medicaid rates for certain safety net hospitals in a sort of targeted way to tie rates to the average commercial insurance rates in certain regions. It, unfortunately, wasn't included in the enacted budget. What were the discussions like around that this year?
You know, it's a great proposal, Chair. I mean, it would solve so many problems if the state and other states have done this. They would, if you set a standard rate for all hospitals, then hospitals could compete on quality.
Yep.
Right, and people still would be complete free choice. Everybody gets to choose what hospital they want to go to, and each hospital gets to say, come to me because I have the best quality. Right now, when you look at the transparency numbers that hospitals are forced to do, health and hospitals will often get like 40% of the reimbursement rate of other hospitals. And it's not because our services are less than, it's simply because we don't have the clout in the commercial market. But the strong protest against doing those things.
But the biggest obstacle was the price tag, or what was it?
Because it would, no, it's because it would cause some hospitals would gain, the safety net hospitals would gain, but some of the other hospitals would lose if you made the rates more similar.
Yeah, I mean, I agree. I think we need to be doing everything we can to support our safety net hospitals. So.
Agreed. Thank you.
Last question for me, and I'm going to turn it over to Chair Narcisse. Has H&H been in discussion with OMB on state budget and timing for the reopening of the psychiatric beds?
In terms of the psychiatric beds, we currently have sufficient funding. It's not a funding issue, not OMB's fault. It's what Jason was talking about, hiring mental health professionals.
So it's a staffing issue.
Especially psychiatrists. Part of what happened in COVID is psychiatrists learned that they could work virtually, do good care, often without taking insurance. They do hourly visits, and convincing them to work on an inpatient ward at a much lower price, where patients can be disruptive and difficult at times, has been a huge challenge. And we're working with the state, and I'm a big proponent. The staffing mix has to change, because we simply cannot hire the number of psychiatrists that would be necessary to open those beds. But it's not a money issue.
What is your vacancy right now at the agency?
Overall?
Yeah.
You know, an overall? I don't think we have a overall. I mean, I happen to know it in certain areas. For example, if we, in nursing, we have 2,000 vacant positions.
Wow.
So it's huge. In terms of our inpatient psych beds, we could open another third if we had enough staffing. In the case of the vacant nursing, our positions are below market, and we're working very productively with OLR and OMB and NYC to fix that. But in the case of mental health, it's purely the market. There's just nobody to hire. The other hospitals have exactly the same problem we do.
Thank you, Doc. Obviously, I want to really acknowledge the great work that H&H did throughout COVID. I mean, for certain neighborhoods that had no interaction or engagement with our public hospital system, I think the work that they saw done by your folks during COVID certainly opened their eyes to if nothing else, the importance of our public hospital system. So that didn't go unnoticed. Again, and certainly in neighborhoods where all their engagement might be only with private hospitals, I think it really opened their eyes, and I hope it continues to head in that direction with people understanding the importance of our public hospital system.
Thank you.
I'm going to hand it over to Chair Narcisse. We've also been joined by Council Members Velasquez, Joseph, Schulman, Carr, and Hanks. Thank you, Commissioner. I'm going to hand it over to Chair Narcisse.
Good morning again. And I'm going to co-sign that we need our public hospitals to stay open. As a nurse, yes, we need a hospital. I know healthcare is important to us. My question line going to go toward traveling nurses. Can you tell us for each year, 2019 to 2022, and year-to-date, 2023, how much you have spent on agency traveling nurses? How much traveling nurses are making per hour?
Okay, Linda's going to give the numbers.
So what we have available is for calendar year 2022, we've spent a total of $552 million on, $549 million on agency nurses to support our facilities. There was a lot of variation in that spending level over the course of a year. So from the start of the year through the end, we have reduced temp utilization for nurses by about 3%, and reduced overall costs by 35%. So during the course of the year, the utilization was impacted by initially the Omicron wave in the first quarter. We were then able to begin to ramp down in the second and third quarter, particularly as we began to phase out some of the testing. But in the last quarter of the calendar year, we were affected again by the tridemic that was happening at that point. So there was some up and down. We did overall see the hourly rates come down over the course of the year as well.
So how much per hour?
We have at this point
The nurses are making per hour.
The average is, I believe, roughly
120.
It's about 120. It varies
120.
again over the course of the year.
Can be a little different by specialty, and it varies by how tight the market is at a particular moment, because typically they're 12 or 16-week periods that you get a group of nurses for. And at certain points, when nurses are very high in demand, the price goes up, demand goes down, price goes down a little bit, but it's always too high.
So average is 120 per hour.
Roughly.
What sources of funding, city, state, or federal, are using to pay for traveling nurses?
It just comes out of our regular revenue budget. I mean, if we weren't so successful in revenue, I don't know how we would have gotten through this year.
So it's not tied up with the city or the state funding where you pull that funding, is overall regular revenue?
It's regular revenue. I mean, a lot of it reflects state Medicaid and Medicare funding, but I mean, the health and hospitals is primarily a revenue-driven department. Chair Brennan had began by pointing out we have a $1.8 billion subsidy, but we're a $10 billion department. So almost everything we do by providing the service. And if you provide the service, generally you get a revenue. If you don't provide the service, no revenue. So that's why many times we can do something. If we can hire the people, we can do it. If we can't, in the case of mental health, we can't hire the people, we can't do it even though we could have the money, because we would get a revenue for it.
Can you share with us the names of all the city agencies, organizations you collaborate with to hire, just like the hiring agency for the traveling nurses?
We use a managed service provider. It's a single vendor, and they're like an umbrella group with the different nurse registries, and they're the ones who bring us the services.
The contracting, what's the contracting?
So we contract with a managed service provider. Do you have a?
What's the name?
That's not the name of a vendor. It's an organization that essentially pools all vendors, and we deal with the one group.
Right, so
Right sourcing.
I got right sourcing, that's right.
Okay. You
Linda has it
outsource.
Right sourcing.
Okay.
They are the umbrella, but under right sourcing are other agencies.
There's other agencies. What are the agencies?
We don't have that available, but it's effectively accessing the full market of agencies through this single vendor.
The idea when we did it was that they would be better able to get you nurses and better prices than if you did single contracts. So they're the umbrella, then the contracts, they pull from the different kinds of nurse registry. But we'll find out for you. And we'll send
Yeah,
you
it's just like a middleman, like sound.
Yeah.
They're making money off other agencies.
Yeah, I think that's fair.
Okay. What is the value of the contracts you have with them? Broken down by agencies. But now, from my understanding, you would not be able to do that because that's the middleman umbrella that's doing all the work.
Yeah, I think what we should provide you is just the list of, numbers of, beyond the numbers we've had. I don't know, do we have for today more?
No.
We don't have anything more detailed today, but we'd be happy to provide your office. I mean, the big line which you have articulated is this isn't good. This isn't what we want. We want to hire our own nurses. We do not like the idea that nurse agency registry nurses take off probably about a third of the money, which goes directly to them, so it's not, the traveling nurse doesn't necessarily get the full amount. We want our own nurses. That does require that we have a wage that is competitive. We can't, I'm really stuck if I got 2,000 vacancies, which is what I got. I have where we lose about 40% of brand new nurses within the first year. They come to us for training and then they leave because they can earn, $20,000, $30,000 more nearby. Health and hospitals will never be the highest payer of nurses, nor do I even aspire to that. I aspire to be competitive. I aspire to provide wages similar to what they would get at other hospitals. We're working with OMB and OLR and NYSNA to have a contract that will do that. And as soon as we have such a contract, we will stop using the registry. But on the other hand, if I don't use the registry, I'd have to close my trauma centers. I mean, I just can't run 2,000 nurses down.
The biggest problem I have is the middlemen, because they take all the money, which I'm in agreement with you, and they do not do the work. But the nurses are doing the work, so we're gonna have to meet somehow. So that's why we're asking the question to understand. And once we have the data, we have the number, we can have a better understanding, because the nurses are here and we want to keep them. So how have this contract costs changed over the years?
It's a little lower now. It was at its highest during COVID and highest during the crisis where we had RSV in sort of the November, December months. As I was saying, you typically contract for 12 to 16 weeks, and how much they charge you per hour depends on how short nursing is. Some of these nurses, we believe, have been in New York for years and would stay in New York if we had a competitive wage. Some of them are truly travelers and enjoy 16 weeks in our lovely city, and then they're ready to enjoy 16 weeks in some other lovely city. But our target really are the ones who we know have been here for 2 or 3 years. We think if we had a competitive wage, they would come and work for us. And then we would cut out the middle person.
So can you look back from the 2019 to present?
Mm-hmm. We'll get you the rates 2019 going forward.
Okay. The executive plan shifts from $30 million in funding to DOHMH for traveling nurses in this plan. How much has H&H paid to DOHMH for traveling nurses in total this year?
So in this case, we're helping out DOHMH because we get more attractive rates than they can get because we're such a large user of the services. So, I mean, to us, it's a pass-through financially. They need the nurses, we're providing the nurses. The cost is $30 million. They pay us. It doesn't affect us plus or minus.
So the total?
30 million.
30 million total, okay. Asylum seekers, which we know. Now, we have some schools, auditorium, or is it gym, or auditorium? The gym. So now, is H&H involved?
To be honest, I mean, we're involved in the sense that we're part of this, right? And I would never throw blame to anyone other than, we're all part of this. I don't think anybody views schools as an optimum choice. I think all of us are struggling with how to humanely care for people who need a roof over their head in a city where there's, I mean, we're literally running out of hotel spaces. We have not wanted to put families in congregate spots. We have had success with congregate living for single men, but we have not wanted to put women and children in congregate spots. I think that the idea of the schools is temporary, 2 to 3 days, just to give us enough time. I mean, sometimes 400 people arrive in one day. I mean, it really makes me so proud of New York that we do this at all, right? I mean, you can imagine 400 new people that you didn't have now need housing and food, and we're doing it. But increasingly, we're lacking the spots to do it. When the Roosevelt Hotel opens on Friday, that's going to help us. It's 800 rooms. So that will give us a major spot for the next, few weeks at least.
It is a challenging time, and one of the concerns is infrastructure. Are we built for some areas for that? But safety, since we are nurse and doctor, we talk
Yes.
about safety, how safe we are in some areas. The co-chair, I think, touched on that. H&H received additional funding in the plan to support asylum seekers operation, but the spending and projected spending amounts do not quite line up. How much of the spending for asylum seekers operation have gone towards outside contracts or temporary staff?
We don't have that split available, but we are bringing staff on board because of the speed at which these sites need to be set up. We do often rely on vendors to stand up the work quickly. So we are still sort of in transition between the two.
You will share with us eventually, right?
We will.
You'll send it.
We will. Remember, all of this is emergency and unpredictable. That's the
Very.
other thing about it, is we
Very.
never know day to day how many people are going to arrive and need housing. And so it's very challenging to even project the costs for the contracts that we're running.
I know it's difficult, but I know you're going to do
We're
your very
going to
best.
provide, and we're committed to full transparency. We'll provide all the numbers as we spend the dollars.
Okay. How much of the $748 million added in fiscal 2024 will go towards supporting H&H personnel and staffing?
We've broken the 748 down?
We have not yet. It will be part of the analysis going forward.
Again, our usual theory, we have to treat this as an emergency. We go out and we do a contract to start it, and then we figure out how we can do it
Transition.
ourselves. So like the show vans were begun, those are the vans that go around caring for homeless. We started it as a contract, somebody who knew how to do that, and then we replaced the contractors with us. We found that to be the most successful model for things that have to get done really fast.
So you make transition out of what you started.
So once
You transition.
once you get some experience, then you have a much better
Understand.
sense of what you need.
Okay. How many dedicated staff do you have that work specifically in the HERC? That's what I want to
The
ask.
HERC.
In the HERC.
I don't have that. I would, my SVP Ted Long has been, he lives this. And he has several very dedicated staff. Whenever I'm talking to them, they're at a hotel, they're at a center. They've been amazing through all of this.
And I will second that because he has a compassion to serve.
He
for the
does.
hearing. Yeah. How are we meeting the demands of clients coming into the emergency shelter system that do not have outside care?
We put the health and hospital umbrella over them. We provide whatever services they need. We do a lot of immunizations for the children, and we do a lot of crisis intervention. People who have trauma from the events, marital discord, family discord. These people have been through a lot in the very recent times.
Thank you. I'm gonna go to Be Heard. Thank you for sending the data. Now I can see the precinct. Some of my precincts have it, and I hope we can continue providing care for mental health. In the needs, because what I realized in the data, that the percentage of responding of the transporting the people to hospital has been increased. So from 46 to 59. My question around that is the needs are more severe. Why is that?
So I'll start just by saying that, Be Heard never sought to eliminate or necessarily see a significant reduction in hospital transports, right? The program really aims to do and decrease unnecessary hospitalizations. So what we have been seeing is by having this mental health and health professional on-site making assessments, we're doing a better job of connecting folks to services in the community and making a smoother transition into the hospital when that's necessary. Again, when it's determined that the individual needs to be transported to the hospital for a more comprehensive assessment, we're seeing that better experience for the patient because there's a mental health professional kind of walking through that process. So we expect to see some variation depending, especially as we move from one place to another and expand geographically, we're going to begin to see variations in those hospitalization numbers.
Thank you. For some of the data that I would like to find out, how many calls that you get from Be Heard? Do you have that data? I don't remember seeing that one.
It should be in the yearly data brief, and in the coming weeks, the Mayor's Office of Community and Mental Health is going to be releasing first and second quarter FY23 data. So you should be able to see that in the coming weeks about.
On that note, I want to know how many of the folks that call and receive the services, because I can call and don't receive the services.
Yeah, and that's in there around how many folks are calling and getting the traditional response and calling and getting the Be Heard response.
Okay. How many hours of training and what type of training do Be Heard response team members receive?
So the teams collectively, both the EMTs and the social workers, undergo an extensive 4-week training where social workers and EMTs are trained together on various topics like de-escalation, motivational interviewing, how to engage with special populations, first aid. So it's really meant to be a comprehensive training to get both sides, again, the EMTs and the social workers, the training that they need to do emergency medicine in the field and emergency mental health care in the field.
Okay. How many hours of training and what type of training do 911 dispatchers receive regarding mental health and crisis call?
So we would defer that to our colleagues at Mayor's Office of Community and Mental Health, NYPD, and FDNY regarding how 911 operators are trained as they're more directly involved in the 911 operations.
I got that, but you're not, since it's Be Heard, you don't have in touch with the data from the different pools of the services.
Not for the 911 system
Okay.
directly.
you
We,
don't know.
again, as Dr. Katz mentioned, we really provide the social workers that go out on these teams.
Okay. Yesterday, DOH-MH testified that they paid trainings to they give training to be heard staff. How is H&H training different than DOH-MH trainings?
Yeah, so DOH-MH provides a number of different trainings, both on substance use, I believe, and also on some of the other services that they provide in the city, which is part of that collective 4-week intensive training with the EMTs and the social workers.
Mental health. In our preliminary budget response, the council called to the inclusion of $2.2 million to hire reproductive health at all H&H facilities. Can you talk about the benefits of providing mental health support to expecting parents before and after childbirth?
Well, Chair, I mean, you're more expert than I am. You know, as a nurse, how important it is, how challenging the period of time is before birth, I mean, after birth, postnatal depression is a huge issue,
Yep.
which was long misunderstood. You know, women were blamed for sort of not loving their child enough. I mean, horrible. Before people understood that this is, you know, a physiologic condition and needs to be supported. And so I'm just incredibly grateful for the City Council, you know, for supporting this initiative. I think it will help an awful lot of brand new parents.
And you know we have 31 women in the city council, right?
That's why good things happen.
All right. How many H&H facilities currently have psychiatrists on staff? I think on staff for parents,
Well, all our
for the parents.
facilities have psychiatrists on staff for parents.
Okay. We're changing to asthma. As we discussed at the preliminary budget hearing, community programs that provide asthma prevention services utilizing, which is CHW, are at risk for losing their funding, if not restored by the administration. Does the executive plan reverse this cuts, and how much will CBOs stand to lose in FY24?
The cut is not restored by the executive budget. The program had been previously funded by a grant mechanism that has gone away. So we used to be able to support it through DSRIP funding, which ends June of 2023. To make sure that the clients don't lose the services, we're going to use our public health core to continue to provide the asthma services that were previously provided through the CBO.
Okay, and I told you my concern last time you were here.
Understood.
Okay. We want the continuity of care when it comes to asthma, because the asthma affected the Black and brown communities the most, and I know you're well aware of it.
Yes,
And you do.
absolutely.
And I'm concerned about them not continue coming to the facilities to get care because they're so used to the CBOs. But we have heard, but not have been able to confirm, that the enacted state included funding to support community health care workers' services in the state. Are you aware of this funding?
There is a provision in the budget that could provide funding for community health workers. We still need additional detail from the state to understand specifically what services will be covered, so we'll continue to explore that.
Okay. So you're hoping to receive the funding?
We certainly hope so.
Yep. Can we utilize this funding to continue the asthma or COPD program?
We'll have to discuss with the state and get the details.
Okay. But if you do, you will make sure that we continue
If
it,
there's
right?
any possibility, we will pursue it.
Okay. On the state budget, FMAT, The enacted state budget includes cost shift into FMAT funding that we tried to lobby. With H&H be affected by the New York State keeping the FMAT money instead of allocating it to counties in NYC, what is the impact on the city?
That change does not affect health and hospitals. It's directly between the state and the city.
So thank you, and I'm going to turn it over to my chair, co-chair. Anybody else join us?
Okay. Thank you, Chair. We're going to start with questions from Council Member Brooks Powers, followed by Joseph.
Thank you, chairs, and hello, Dr. Katz
Hello.
and team. It's always great to see you. I just had about 2 or 3 follow-up questions from the prelim hearings. And I know that Chair Narcisse started down the path in terms of NYSNA and the nurses and pay, but I just wanted to know if you could just walk us through where like H&H is with the negotiations right now with NYSNA. And then also, when you were here during the preliminary season, I asked about health and hospitals spending on traveling nurses. And the Daily News had reported last week that the city spent at least $197 million to pay for temporary traveling nurses for the first 3 months of 2022. So I wanted to know, how much did health and hospitals spend on traveling nurses last year? And does health and hospitals have an estimate of how much it expects to spend on traveling nurses in the coming fiscal year? And then I have another question, but
Okay. I'll do the broad on the, and then Linda will do the exact on the dollars. In terms of the negotiations, so it's open. OLR is meeting with us and NYSNA every week. In fact, I think today is negotiation day. OLR and OMB understand the NYSNA requests and also understand that I can't staff hospitals unless my wages are competitive. There is a market. If you want to be a police officer, you should want to be an NYPD. And if you want to, but there's no other municipal police officer. In my case, there are other safety net hospitals where nurses can do good mission. The fact that we have 2,000 vacancies and the dollars to hire them, and the fact that people leave 40% after the first year because they can get a markedly higher job says everything you need to know, right? We don't currently have competitive wages, and the city understands this. And so I'm very hopeful that in the next few weeks that we're going to have a resolution of this that will enable us to stop traveling nurses. My happiest moment would be that we didn't use traveling nurses at all. It's not, especially now that we're out of an emergency situation. I mean, certainly during COVID, I mean, one of the most amazing statistics of COVID is that health and hospitals credentialed 10,000 healthcare providers from all over the country during COVID. You know, nurses, doctors, social workers, I mean, it was, but we're not in that emergency anymore. Right now, our volumes are quite predictable. And I would always rather hire my own nurse. I think there's a different level of commitment to our patients, to our system, but the wages have to be competitive. So Linda, on terms of how much we spent.
So for calendar year 2022, we spent a total of $549 million on temporary nurses for our facilities.
Thank you. And one last question, Chair, if that's okay. The council's understanding is that due to the late enactment of the state budget, state funding remains unchanged for fiscal year 23 and fiscal year 2024 when compared to the preliminary plan. So how was the funding provided in the state's budget different or similar than what was reflected in the preliminary plan? And given the state's enacted budget, what changes does Health and Hospitals expect it will make to its budget outlook? And just wanted to also know, lastly, can you provide an update on any negotiations that are ongoing with the state or federal partners for further funding?
So on the state budget, the issue is that we still can't tell completely what the impact is. That several of the initiatives, because there were several positive initiatives and several negative initiatives, and several of them depend on interpretations of the language and of the rates, that we're working very hard with the state, but we still don't have a number. And that's why I think the decision was made for this budget to just leave it as it is. As soon as we know, we're happy to share it. You know, I'm hoping that it's not too negative. But it's just impossible to say because several of the things that were passed were not clear until the regulations get written to implement it, how it will affect our financial future.
And then in terms of negotiations on any additional funding from the state and the feds?
The state is closed. On the feds, our delegation has been very good and has put forth a large number of projects for us that our two senators, Senator and Leader Schumer and Gillibrand, have then forwarded. So we're hopeful, but the federal process seems at the moment even harder to predict than the state process, just reading the newspapers.
Do we have any new hospitals on that list?
Not yet.
Okay.
But
Well, I'm still rooting for it. I'm hoping that the Rockaway Trauma Hospital that we're working for will be on that list as well. Thanks, Dr. Katz.
thank you.
Joined by Council Member Gutierrez. We now have questions from Council Members Joseph, followed by Schulman.
Thank you, chairs. Dr. Katz, always good to see you.
Same, thank you.
The last we were here in April, we talked about language access, especially for Kings County Hospital in my district. I just wanted to follow up and see any updates, and is it included in the executive budget?
So yes, it's included, and my residents, who are often the ones who most in need of translation, tell me it's way better. And we did a number of initiatives, both the hiring of a natural Haitian Creole speaker, and also improvements in the phone line itself, because there'll always be times when you have multiple people who need translation at the same time. And I told them to do whatever was necessary to make sure that it happened, and I went back and checked, and people feel that things are markedly better. So I thank you, I thank the chair for promoting it.
Thank you so much. I had a quick question around mental health for young children. I know I speak to a lot of schools a lot as the education chair, and sometimes it takes a long time for parents to get appointment with mental health providers, especially more than ever, our young people are in need of mental health support. So can you tell me a little bit?
Yeah, I mean, I would totally agree with that. There remains a major shortage of mental health professionals, and even more so for children, in part because, as you know from your work, there's really an epidemic of mental illness among our children. I think certainly part of it is COVID, part of it is social media, part of it must be other things that are affecting them. And it's just very difficult right now. We are looking at other models to try to do it. I think a promising model is to do additional training of pediatricians to be able to care for children who have moderate mental illness with, supervision from a child psychiatrist. But there's just not enough child psychologists or psychiatrists right now to meet the need.
Absolutely.
Again, it's not a money issue. It's
No, it's just
it's a
there's a lack of.
workforce. It's a
Even
workforce
across the
issue.
schools, they have to share You'll have psychologists that goes 3 days at another school and 2 days. So that's what we're seeing. But the length of time for a parent to make an appointment to see a mental health provider in H&H hospitals are pretty long. So
Yes.
we would like to see that cut down, of course, with solutions.
We are, us too. We're working at it.
Okay, thank you so much.
Thank you.
Thank you, chairs.
Councilmember Schulman, followed by Carr.
Thank you, chairs. And I want to, good morning, Dr. Katz.
morning.
And I want to say that in a previous life, I worked at H&H off and on since 1989, as a matter of fact. And you've done an amazing job with updating the facilities and the staffing and everything else. And I want to commend you for that, and the finances of the system, which is difficult, and did a yeoman's work around COVID. So I'm going to ask, I know there was a lot of talk about nurses. I'm actually going to ask about the resident physicians. So what is H&H doing to ensure resident physicians get pay parity?
Right, so a few things. You know that the CIR strike was put off for the two non-H&H hospitals. And so we still have a strike notice for Elmhurst for next week. But negotiations are going on, and I'm hopeful that since they were able to solve and resolve the issues with the other two hospitals in Queens, they'll be able to do it with Elmhurst. City has not yet begun the CIR negotiations, but that's fairly typical that the smaller unions, I mean, the city has some huge unions that it needs to resolve the issues. But I certainly feel great support from OLR that they will get us a resolution and recognize that, you know, there too, there's a market and our residents have to have competitive salaries.
So I understand that H&H pays Mount Sinai through an affiliation agreement to manage the residency program. Is that correct?
That's correct.
How much money does H&H pay Mount Sinai, and as a total, just to the other hospitals in there for the affiliation agreements?
So the way the affiliation agreements work is we pay actual expenses plus what is a pretty small admin fee. I don't know, do we have the...
Do you have the amount?
We don't have the exact number
Can
here,
we
but
get
we're happy
that?
to provide it. Our affiliations are Mount Sinai for Elmhurst and Queens, NYU for Bellevue, along with Gouverneur and some of our skilled nursing facilities, and SUNY downstate for Kings County. So those are the three, and we're happy to provide it. They're open information, no problem.
No, that's great, you know, because the resident doctors, unlike some other staff, don't necessarily have choices in terms of if they're not getting paid well or they're not being treated well to go somewhere else. And, you know, so that's something that's really important, that not only in terms of the pay parity, but the treatment, because my understanding is that the folks, that Mount Sinai is not treating the residents appropriately, pay parity aside, in some of these places, including Elmhurst. So I just want you to, if you could please take a look at that.
That's great. We did institute an anonymous line specific for residents because there are some, as I'll say as an older doctor, there's some generational issues that not everybody has caught up with. That people have a sense that, well, I did this, you know, 40 years ago, but the world has changed, and people have acceptable behavior 40 years ago is not acceptable behavior today.
No, I appreciate that very much. I also, if I can ask one other question, Chair. Switching gears, I had heard that there was plans for a women's health facility at Elmhurst. Is that still moving forward?
Yes, still moving forward.
And that's capital monies, right?
Yeah, capital and would bring together the services.
If you could please make, because as the chair of the health committee, that's something that's very important to me, in women's health and as a breast cancer survivor. So we'd like to,
Great.
when you have updates on that, please, like to
We would be delighted.
collaborate. Thank you very much.
Councilmember Carr, followed by Hanks.
Thank you, chairs. Dr. Katz, good to see you as always and your team. I want to talk a little bit about the opioid settlement monies that have been discussed of late. And if you could just elaborate a little bit on the record in terms of H&H's share of the distribution of those monies in this initial tranche, and specifically how that relates to Staten Island.
Right. I'm going to let Linda get the exact dollars, and again, I'll try to do the high level. The money was given to health and hospitals, to DOH, MH, and to the Office of the Medical Examiner. And traditionally in the city, when the idea has been that for things H&H can do, we would do. For things that H&H can't do, DOH, MH would provide funding as like the city umbrella. I understand and I mourn that there was not a specific amount, given to Staten Island. I see that clearly as a problem. My understanding is that the city is working hard on trying to resolve it. That the AG is also involved and recognizes that there needs to be a solution. And then on the health and hospital side, what we've proposed is that we would send a show van to Staten Island. And show vans have been very successful. They provide buprenorphine, which is, the evidence-based treatment for opioid addiction. We can do it directly from the van. And so we're putting together the team so that, that we can show that while we don't have a brick and mortar, hospital, that we're still providing the services. Linda, can you give dollars?
So we've received $14 million in total from the program.
That's the health and hospitals opioid settlement dollars.
Yes.
14 million.
I appreciate that. So, listen, I thank you for acknowledging the crux of the matter, as it were. But I think what I'm hoping for, and I understand that there's folks working in earnest to rectify this situation, but I think, DOH-MH aside, even though we don't have a public hospital on the island, you do have a significant presence on the island, in particular the Seaview campus in my district, which we've talked about in the past. And on that site, you have one of the best addiction recovery providers there is in Camelot. They're absorbing Amethyst House, which is their female equivalent, which is not on site. And so I hope that as we figure out ways to rectify this borough equity problem, that we focus in on opportunities like that, especially given that they're a tenant of yours. There may be ways for you to think more creatively about how to apply a fair Staten Island portion of that 14 million.
Understood. Thank you.
Thank you. Thank you, chairs.
Okay, now we have questions from Councilmember Hanks, followed by Farias.
Thank you, Chair Brennan, Chair Narcisse. Good afternoon, Dr.
afternoon.
Katz. Nice to see you.
Nice to
Thank you
see
so
you.
much. I definitely want to associate my comments with my colleague and delegation person, Councilmember Carr. So my question is kind of revolves around public safety and Be Heard. So Be Heard is the new health-centered response to 911, to mental health calls. The point of the program is that the 911 call operators are to dispatch Be Heard teams as a default, like first responders. My question is why do police continue to respond to more than 80% of the mental health calls in Be Heard precincts during Be Heard hours of operation, and why is this percentage increased rather than decreased over the life of the pilot?
Yeah, so I think, what I'd say is, we're continuing to learn a lot about how to run a new emergency response out of 911, right? So I think, partially I think there's some questions that should get referred to OCMH and to FDNY and NYPD around 911, but I think it's something that is continually being worked on to increase those numbers. Ultimately, there are just some calls that do come to Be Heard, calls that are non-violent, non-weapon, and then there are calls that don't. So calls where it's not clear what the person on the other end of the line, what the safety risk may or may not be, or when there's a weapon or when there's violence. So I think that's a confluence of factors about why why the numbers are the way that they are. I will also say that in the coming weeks, there will be some new data coming out from OCMH for the first 2 quarters of FY23.
Thank you so much for that. Would you be willing to share some of that data? Are there patterns that we're seeing? Because, Be Heard is supposed to be a program that offers a non-police response to the mental health crisis. So we want to understand if it's working or not, and what are the things that we can do to ensure the safety and the public safety of our citizens and their interactions with NYPD, their interactions with someone who's having a mental health crisis. Thanks.
Yeah, and I don't have the data that's going to get published in front of me at the moment. What I can say is what happens when Be Heard does arrive, when we look at what is successful and what is not. What we do know is that 30% of folks that are seen by Be Heard are treated in the community, in their own communities, either in place or in community health centers such as the Support and Connection Center, and that we see a significant reduction in hospitalizations. So only 54% of folks that are seen by Be Heard are taken to the hospital, compared to about 87% with that traditional response. So, we're trying to get out to as many calls as we can, and I think we're very much still a pilot, even though we're expanding citywide and trying to learn about how to get out to more calls.
Thank you. One more question, Chair. Have you experienced, what would you say have been the challenges, if you could name one?
Of Be Heard generally?
Yes.
Of course. I think you're right with the challenge of getting out to as many calls as we can, right? I don't think anyone is particularly satisfied with not going out to more calls. And I think working within the emergency response system is rewarding, but I think it's also challenging. It's a place where, mental health hasn't really shown up because it has been in a pretty closed system. So I think we're doing incredible work getting out to the calls that we're getting out to, and I think we're doing incredible work, especially when we're on the ground, seeing, I think, some incredible outcomes.
Thank you so much. I look forward to seeing that report. Thank you, chairs.
Okay, we have questions from Councilmember Farias, followed by Gutierrez.
Thank you, chairs. Thank you, folks, for testifying this morning. Hello. I have 2 quick questions on some of the PEGs and subsidy reductions. One of the PEGs for health and hospitals was the reduction or cuts of the subsidies that H&H receives from the city by $16.6 million in FY24. Why was this reduction taken, and what services will be impacted?
No, this is the archive. So the services, we are looking at some efficiencies and in-house revenue initiatives that will absorb that cut. What the PEG actually did was just reduce the amount of the city subsidy to us. So there is no direct service impact, and we are working to mitigate the financial impact to the system.
Can you explain a little bit further about how you're looking at how that reduction is going to?
So when I say big picture, which is what we began at, our subsidy for health and hospitals is $1.8 billion, but our budget is $10 billion. So we are primarily a revenue-driven department. So, our first choice, if we can, if the city requires that we reduce its subsidy, is to try to figure out if we can grow the revenue or find enough efficiencies so that no service cut has to happen. And right now, it looks like we can. That's some of it, will depend, as we were talking earlier, on where the state budget finally ends, when everybody understands the implementing regulations, whether we're, even or close to even versus a large cut.
Okay, great. Thank you for that. The executive plan proposes a $4.3 million reduction in fiscal 2024 to ACS for family court services. Will this reduction have an impact on the delivery of MH services? And what role does H&H play in ensuring things are seamless considering the reduction?
We're going to work with ACS. We think that they didn't realize that there were some non-city revenues in this program, and that we think that we can work those revenues to prevent a service cut. So more on this one soon, but when we learned about it, we realized that maybe there's a potential solution to this one.
Okay, and when you say more on this soon, what does that mean?
Well, it means I have to call ACS and say, we think you missed that there was some federal and state revenues attached to this program, and I think we can use this to fix it. But we learned relatively recently about the cut itself, because it occurred in their PEG, not in our PEG, and so then we learned about it. But we have great relations with ACS, and we'll work it out.
Okay, great. And lastly to this, how much funding is budgeted for these services, and do you folks think that's sufficient?
There's $2.3 million remaining, and as Dr. Katz said, we're working with both OMB and ACS to ensure that we have sufficient funding to fully meet the needs of the program.
Great. And Chair, if I may ask a question, I am asking a question on behalf of a colleague who had to step out, Councilmember Hudson. She wanted to specifically ask around PPE and free tests and whether the budget includes any funding for it. We've been hearing that the PPE program is ending or has ended already, and a lot of our community organizations still need them and require testing before events. So she just wanted any update or further details.
Right, so all of the PPE expenses and the testing expenses are now considered part of our regular budget.
Okay.
So, revenue, but we don't currently have a program for dispensing PPE to CBOs or others.
Okay, so that was fully eliminated when we
Yes.
determined this is endemic, no longer pandemic?
Yes.
Okay, so this will basically, the city is asking folks to put this in as parts of their costs.
Part of their cost of daily living.
Yeah, okay, perfect. Thank you, folks. Thank you, chairs.
Thank you.
Councilmember Gutierrez, followed by Osei.
Thank you, chairs. Thank you. Good morning. I have a couple of questions and just want to uplift what my colleague, Councilmember Schulman, raised about pay parity for specifically the interns, the residents at Elmhurst Hospital. In my past life, I was born there, so it's a very important hospital, not for me, but just for all of Queens and Brooklyn. I am across the street from Woodhall, which is in Councilmember Osei's district, but oftentimes when they can't go to Woodhall, they're going to Elmhurst, so this is a lifeline. This is not just personal, but it's something for all my constituents. My first question is related to a benefit that I am aware, I think is available to the Mount Sinai residents, but not at the Elmhurst Hospital residents, which is pertaining to transportation, specifically between the hours of 8 p.m. and 5 a.m. I know you know this. My sister was an intern. They're working around the clock, and oftentimes are being asked to come back hours later. So what can you speak to as far as extending that level of care to the residents at Elmhurst and making that a package part of the pay parity campaign?
Sure. I'd be happy to talk to Mount Sinai about that particular benefit. I wasn't personally aware of it.
Yeah, it sounds like they get access to either Lyft or Uber, or in the events that residents drive but are like too tired to drive home, which we want them to get home safely.
Correct.
My next question is related to compensation for residents. So I understand that including those in H&H contract, residents receive compensation when they have to cover a call for another resident who is out sick, but it's not clear whether residents at Elmhurst receive that compensation when they're covering a shift for a sick resident. Do you know anything about that?
I don't know, but it's good you're telling me, and I will make it part of the negotiations.
But that feels wrong, right?
Everybody should be treated the same, right? I don't see any
Agreed.
reason why
Agreed.
one hospital would be different than...
Agreed. And so my argument about Elmhurst Hospital, it's an H&H hospital serving majority immigrant community. Chair Narcisse worked at Elmhurst Hospital,
Yes, she did.
serving immigrants. And Elmhurst Hospital has a very unique program in that the majority of the residents are international.
Yeah.
So what I am trying to uplift is the blatant connection of serving immigrant communities by immigrant physicians and the level of care that they're receiving to do their job. And we really need to ring the alarm around equity. The last piece is I think that's it actually for all my questions for now. If you could just shed in the next 24 seconds a little bit of more light on the pay parity piece for the residents. I know the last increase that they got was 2 years ago, but the concern for us is we never want level of care to feel different for patients and certainly not for the people doing this work. So how committed are you all to making sure that they achieve pay parity in this negotiation so that we're not spending time on that at these hearings?
I'm absolutely committed to all of my employees getting fair wages and being treated well. And, you know, I'll always push for that.
Councilman
Hi, Dr. Katz, and thank you, chairs. I know that H&H is anticipating an operating loss due to costs of temporary staffing and delays in federal funds. So one of the only questions that I have is, how is H&H going to deal with this operating loss, and how are you planning to cut costs to deal with the loss?
Understood. Well, I mean, I'm very glad we solved this year, and I'm a big believer you have to live to deal with tomorrow's problems. So we got through this year's, because when we came in the January, we were about 124 million to the negative, and we solved it. So we're through this year. I think next year, you know, we will need to do some combination, ideally, of revenue enhancements. We've been very good at that. At some point, we will probably level off, but at least so far, we've been able to come up with additional initiatives. I never want to cut services. Right, I come from the opposite end where, you know, we get up every morning to figure out what additional services we can provide to people. So certainly we will not be cutting services without this council knowing exactly what it is. But I remain hopeful we solve the problem. The number seems large, but again, as a variance on $10 billion, it's not very large. It's like 1%, so I'm hopeful. There are clearly long-term trends in health care. Healthcare inflation is running higher than regular inflation. And so salaries, goods are all way more expensive. And so then the challenge on me is to either, you know, be able to increase revenue equally fast. So far I've been able to do that. There may come a time when I can't. When either I have to restrain services or the city needs to support me more.
Can you elaborate on what those revenue enhancements are?
Well, typically, I mean, the biggest thing, you know, and this has been my 5.5 years of work, Health and Hospitals was so committed to the idea of free care that we never billed for things that we always could have billed for. We were giving people a free ride, insurance, a free ride, right? I'm not in favor of billing patients, but I'm very much in favor of billing insurance. But when you say billing insurance, it's not any one thing. You have to look at each service and be sure you're fully billing all the aspects of that service, that you're fully documenting the services, and still 5.5 years into it, I find opportunities. Oh, look, you know, this is something that we could be billing for that we're not billing for. So, you know, that's what I mostly work on.
Thank you, Doctor, and thank you, chairs.
So I've been joined by Councilmember Lewis, and now I'm going to turn it back to Chair Narcisse.
Thank you, Chair. Before I get to my question, cultural competency is very important to us all. So there is a little video that went viral.
Yes.
What do you think of that?
It was horrible.
It's horrible.
Horrible.
So we need to educate our folks better to be
Yes.
sensitive.
Yes, it's a horrible video.
It's a horrible video.
Person is on leave, so will not be interacting with our patients. Horrible.
Yeah, yeah. Because, and then she wearing the initial, and we could see that. And that's when if you work in a hospital, a nurse, or whatever the role, you cannot be doing that in New York City. We have to be very sensitive to that, and I'm sure you're taking the step toward that.
Absolutely.
For pay parity for our nurses, do you have plan? What's the plan to make sure that our nurses get paid, and we hire full-time nurses in public hospital.
Right. OLR and OMB totally understand the problem. They've heard you, they've heard me, they've heard other members of this city council, and they have told us that they're committed to resolving this with NYSNA. Negotiations are never quick in the city, and I know they're also trying to do a number of other very large contracts at this time, but I've gotten every assurance from OLR and OMB that they're going to resolve it, and they understand what they need to do.
I'm very optimistic, and I'm counting on you.
I will keep pushing.
Because the nurses got to get paid, and we have to hire locally.
I will keep pushing.
All right. The staffing issue is such a big deal. I receive so many texts, and I know it's important. So we have to do this. What is the status of opening the outposted therapeutic housing units or therapeutic beds that serve patients in custody who have serious health conditions?
We are ready. The issue has been that the Department of Corrections has had requests for changing the way the Bellevue model was physically structured. And so we're currently working through with them and OMB the costs of the capital changes that would be necessary. We're very excited about this model. We're looking forward to doing it, but they have to feel that the facility is sufficiently safe.
The plan includes $488 million for the opening of the therapeutic beds. Has H&H requested additional funding to support these vital housing units?
Thank you for your question. We have not. The total amount of the project is $662 million in total, and that is currently sufficient. It did include some acceleration funding that was put in prior years, and we have enough so far to cover the cost of the projects.
I'm moving to older adults guardianship as well. How does the budget allocation for hospital address the increasing cost of providing care for older New Yorkers who are experiencing poverty?
I'm so glad that you asked this question because it caused me to talk to my staff about this issue in general. I mean, certainly we provide, compassionate care to our elders. We take care of many elders. I signed up a 91-year-old patient of mine last week for a variety of additional services through our social worker. But I need to do what your question taught me is I need to do some work on exactly what New York City's rules are. There is a program in Department of Aging and Adult Services, but I don't know a great deal about it. We Health and Hospitals do not have a specific guardian program. And what I'm told is that it's if somebody were to need a guardian, we would refer them to DHS, which does have a guardian program, that there's also a state program for guardianship, and I want to learn more about what the Department of Aging does. But our focus, of course, is on caring for the elder.
Yep. How does the budget address the healthcare needs of older New Yorkers who are experiencing mental illness or disabilities?
Several of our mental health programs are specific to that age group. We don't have a specific breakdown of dollars because we have both mixed programs and specific programs. But we'll see if there's a way. We probably can look at it by demographic to age breakdown.
Thank you.
Thank you.
How does the budget address the needs of limited capacity or incapacitated New Yorkers who are unable to make their own health care decisions and need a guardian to assist them in assessing the care and treatment they need?
We would refer them in that case to HRA if they needed additional services.
Thank you. How does the budget address the needs of New Yorkers involuntarily removed to NYC hospitals as a result of the mayor's mental hygiene law 9.41 directive?
Because we've always cared for people who were brought in voluntarily, there's no change in the budget. We just do it as part of our function. We run the majority of psychiatric emergency rooms. We see that as our mission.
Okay. How does the budget address the anticipated rise in guardianship cases that are likely to result from the mayor's involuntary removal directive?
We have not yet seen an increase in the guardianship, but again, because it's an HRA function, we would have to
HRA?
work with them, HRA.
Okay. Okay. What role did the community, now we're going to Be Heard, sorry. What role did the community play in establishing Be Heard? What role does the community play in the day-to-day operations of Be Heard?
So advocates, experts, and community members have been involved from the beginning of the program. The pilot came out of the city's work through the Crisis Prevention and Response Task Force, which included over 80 experts, including advocates, city agency leadership, and community members. And we're continuing to ask for their feedback as we learn from the pilot and as we expand the pilot.
Thank you. Does Be Heard route calls through 988? If no, why not? Because I want to know.
Of course. So New York City's mental health crisis teams have always been connected to NYC Well 988 for some time. Because Vibrant, which is the contract holder for NYC Well, offers the same services and handles both 988 contacts and NYC Well contacts the same way, mobile crisis teams have been available via 988 the moment the 988 number launched in July of 2022. Be Heard is accessible through mental health emergency calls made to 911, and if a call is made to 988 or to NYC Well, and it's an emergency, Vibrant is able to transfer that call directly to 911, where 911 would then follow their process to dispatch a Be Heard team. You know, Be Heard is not directly activated by NYC Well or 988 because Be Heard is part of the 911 emergency response system, but someone who calls 988 and needs any service through 911 can get connected into the 911 system.
Gotcha. How is it determined that mental health crises that take place during the 8 hours a day that Be Heard teams do not operate are not entitled to a Be Heard style non-police response?
So this goes back to the hours that Be Heard is operating from 9 a.m. to 1 a.m., really corresponding to that 80% of mental health calls that come into 911. Yeah, as we continue to expand across the city, we're looking at that operational feasibility of adding that third overnight shift to increase the coverage from 16 to 24. But overnight shifts are really the hardest to recruit. So our focus has really been on filling those 2 shifts and expanding geographically and then focusing on expanding the hours.
So my understanding is data-driven. Like you had the 911, 80% of those calls were happening between those hours.
That's right. We looked at when we started the program, we looked at the distribution of 911 calls literally by hour and saw that 80% were within those 16 hours a day.
Gotcha. What are individuals experiencing mental health crisis or their family members or loved ones not permitted to specifically request a crisis response by a Be Heard team?
So we would defer this question as it deals with the operations of 911 to our colleagues at OCMH, NYPD, and FDNY.
You know, so when I asked you those questions, because you're operating that, I thought you would be interested in 911, what they do.
We
don't have the statistic?
We're very interested in what 911 does, and
All right.
I think what we can speak to is why they do certain things.
Okay, I got you. If Be Heard is considered to be a program that offers non-police response to mental health crisis, why is the NYPD one of the agencies in charge of the Be Heard pilot?
So Be Heard represents a coordinated effort between multiple city agencies. So FDNY EMS, Health and Hospitals, obviously, Department of Health and Mental Hygiene, the Mayor's Office of Community Mental Health, and NYPD. And it's really meant to move us towards this more health-centered approach to mental health emergencies. The ones who are doing the work on the ground every day is FDNY, EMS, and obviously Health and Hospitals providing the social workers, with the Mayor's Office of Community Mental Health providing programmatic oversight. But NYPD has a role to play and has had a role to play in kind of running 911. So they're one of the voices at the table.
Okay. How are the lines of authority among the agencies in charge of the Be Heard pilot delineated?
So again, we have FDNY, EMS, and H&H managing the Be Heard teams, providing training, ongoing support. And then we have the Mayor's Office of Community and Mental Health providing programmatic oversight for the pilot. And then we get additional guidance from our other two partners, DOHMH and NYPD.
We're doing good. Thank you. Okay. Is any preference given to hiring Be Heard employees? Be Heard employees who are peers, giving the research showing the effectiveness of the peer response to mental health crisis?
Absolutely. We currently and have always prioritized lived experience in hiring for the social workers within Be Heard. Many of our EMTs and many of our social workers bring their own lived experiences to the table. Many of the social workers on the Be Heard teams not only have decades of experience and expertise as mental health professionals, they also have lived experience themselves or lived experience with a family member. In our job posting, it is explicitly referenced as a preferred skill.
Gotcha. How is it determined that Be Heard teams require social workers? How was it determined that Be Heard teams require clinical social workers? How was it determined that Be Heard teams require licensed social workers?
So social workers on the team, they're using their experience working with individuals in crisis and a clinical assessment, which social workers are trained to do. To determine if the patient needs to be referred to a hospital or can benefit from community-based support. And it's really this assessment, it's really the work that we're asking the social workers to do, which is why we selected social workers initially for this pilot. While keeping the team composition small, so we're trying to keep it not overwhelming for the patients that we serve, and maintaining the ability to conduct these clinical field evaluations. This is key to the program, but we're exploring other options to integrate peers and other licensures into the program as well.
Okay, I have one last question before I pass it on to my co-chair. Why do police continue to respond to more than 80% of mental health crisis calls Be Heard present during Be Heard's hours of operation? And why has this percentage increased rather than decreased over the life of the pilot?
This is something that we're all looking at within the program, and we're trying to figure out ways to increase the number of calls that we are going to. It is I think one of the key things that we talk about the most within the program, about how we can get out to more calls and ensure that more individuals are getting the benefits that we know that Be Heard offers. It has to do with several factors that are outside of the control of health and hospitals and fall within, I think, the oversight of the Mayor's Office of Community Mental Health, NYPD and FDNY, and their dispatching. So we would refer maybe specifics to them, but it's something that, within the pilot, we're highly focused on, as we want to make sure that we're serving as many New Yorkers as we can.
Thank you. Pass it on to my co-chair, Justin Brennan.
I just have a couple of Be Heard questions that I didn't ask initially. Is there a report that can give the council an overview of the efficacy of Be Heard from 2022 till now? Does that exist, or can you?
There's a yearly report for FY22, which has all of our data for FY22 that we can share with the council. And then we're also publishing our data for Q1 and Q2 for FY23 in the coming days.
Okay. We spoke yesterday to Department of Health, and understanding it's a bit complicated to quantify success on anything related to mental health, right? It's not like filling potholes where you check a box. However, I think it's important for taxpayers to understand, what they're getting for their investment, and if the program is working. So that's something we're definitely interested in. Can you tell us how many mobile crisis teams you have, and if that's something you're looking to expand?
I'll get you the number of mobile crisis teams we have in just a moment. Let me see if I have it.
Okay.
In here.
I'll ask something unrelated, well, related, but not having to do with Be Heard. I know you mentioned before there's about 2,000 openings for nurses.
Correct.
Is it somehow easier to find and pay traveling nurses than it is to hire actual nurses?
Oh, yeah.
Okay, why? Even if I'm asking rhetorically, why is that?
Well, they're getting paid at least 20% more, the nurse itself, and then the agency has a major incentive for recruiting. It's also they are pulling certain groups of people who probably wouldn't take a regular job because they are traveling. It's traveler nurses. They're seeing the world as nurses. It's it's a perfectly cool, fair thing for them to do. So it's two parts. It's the greater pay, and in some cases, it's I don't want a job working in New York for the next 30 years. I want to spend my time traveling around.
Without getting you in trouble with OMB, is it something that you would support? Pay parity? I mean, I'd like to pay our nurses what the traveling nurses get paid so we can hire more nurses.
Right. Well, I don't think, to be honest, I don't think we have to pay what the traveling nurses get. They get more than the private, most expensive hospitals are able to pay. We need to pay fair wages that enable nurses to take the job.
Right.
And that's known to everybody. It's not a mystery what that is. There may be a small group of people who only want to be travelers. Ideally, we wouldn't use them at all.
Okay.
As a nurse,
Good.
But if the pay is right, we will stay. I know that.
Yeah.
So we need that pay parity
Yes.
today, because if we don't get it, we're losing more. And they're more consistent, they're caring for the community. Traveling nurses, just like you said, they come and go.
They come
So
and go.
I
They
hope,
have no commitment to us.
that's why I say I'm optimistic, and I'm counting on you, because we need that
I
pay
have been
parity.
working this issue hard, and I appreciate that you do, and it's important for your voices to be heard on this issue.
And let me tell you something. The nurses, they get tired. The traveling nurses, after they visit, they go bye-bye. They go to where they come from. But we want our nurses to stay. So you can continue. I had to get on that, because as a nurse, I know after a while you want to sleep in your bed.
Of course.
Yeah.
Fork it over, Katz.
Get it done.
We're working on it. We are working.
No, we appreciate your partnership there. It's important that we're on the same page.
Absolutely.
Yes.
Okay.
We
Back
have
to
to finish our question. This is a budget season, and we have to make sure we do our part here. How is that Be Heard continue to transport more than 50% of individuals to hospital? And why has this percentage increased rather than, oh, no, I did ask you that question already. The Be Heard FAQ states that Be Heard teams respond to 9/11 mental health emergency calls within a comparable time as traditional EMS ambulance. So how does the pilot account for the fact that Be Heard response times in FY22 were 15.5 minutes, while traditional emergency response times are 7 to 8 minutes?
So first, I'll go back to Chair Brandon's question around mobile crisis teams. So Health and Hospitals has 8 mobile crisis teams, and as a maybe a reminder, or just a little bit of background, they're deployed out of 988, and I think are incredibly effective tools for folks who are in a mental health crisis and need that in-person support. And really show, when we think about Be Heard as this emergency response, as we're talking about response times, we see the emergency response within about 15 minutes. We have mobile crisis teams that can come in about 2 hours, really rounding out the continuum of this emergency/crisis mental health care. On the response times, I would defer to OCMH and EMS on this question, as their EMS especially, I think, is best equipped to talk about how this response, the 15-minute, compares to their more traditional response. I think the 7 to 8 minutes is more akin to an NYPD response versus an EMS FDNY response. So my understanding is that our 15.5 minutes of response time is akin to what happens when an ambulance goes out to a mental health call.
Thank you. What were fewer than 25% of individuals experiencing mental health crisis assisted on site? And why has this percentage decreased rather than increased over the life of the pilot?
So when we think about on-site, we can think about it in 2 ways. We can think about it on-site where someone doesn't leave their home or where we see the individual. And also we can think about it as connecting to community-based resources. And it's the flip side of the hospital transport coin, right? So our goal was never to necessarily eliminate hospitalizations. It was meant to make sure that people are getting the care and the support that they need. So again, as we kind of expand into different areas of the city, we're going to see different needs. We're going to see different combinations of services that are available to folks. We're going to see different issues, and we want to make sure that we're treating folks how they're presenting to us and getting them to the services that they need. And so I think we expect both the hospitalization and or the transport to the hospital and the on-site and community-based treatment numbers to move around a little as we expand and as we work with different communities.
Okay, when you said to connect, that's mean you connect them to CBOs, different that's serving their communities?
That's right. Connecting them to community-based organizations can be the support and connection centers that are contracted out of DOHMH or outpatient clinics in the community. We can connect them to NYC Well for services. So there's a myriad of options, and the Be Heard teams do a lot of work in the community to identify what are the best options for folks to be taken to or to be connected to during a call.
Thank you, but I want to add something on. When you refer them to CBOs that you have contracted with, are those CBOs local CBOs or just overall just like a list? Because the reason I'm asking that, because being in the line of business and contracting with the city, I realize the list can be very limited to who responded to the calls, but not the needs of the people.
So it wouldn't be actually folks that we contracted with. It would be anyone in the community. And when we mean community, we mean where the person lives or works, or where we found
around.
Absolutely. And it's not limited. It's not limited to folks that we would contract with. It's limited to the community that would serve that individual and their needs.
Okay. What is the breakdown of types of location to which Be Heard teams are dispatched?
So we would defer that to OCMH and EMS as well, as they have the best data on the locations and the breakdown.
Thank you. For each call that was not dispatched to Be Heard in Be Heard precinct during the Be Heard operating hours due to violence or imminent harm, what was the nature of the violence and or imminent harm?
Yeah, so as you're referencing, not all mental health crisis emergency calls are eligible for a Be Heard response. So calls that are directed to Be Heard teams must be triaged first before they're referred to a Be Heard team. Typically, Be Heard teams are not responding to calls involving individuals who require immediate transport to the hospital, present risk of imminent harm to themselves or others, or in situations where EMS call takers just don't have enough information to assess risk of imminent harm, presenting as imminently suicidal, presently being violent, having a weapon, or requiring a tactical expertise or resource, such as being on a bridge or being in traffic or being on a subway train track.
Thank you. What is the breakdown by response of the community-based healthcare or social service location to which individuals experiencing mental health crises were transported?
So because we've been operating in in Harlem, Upper Manhattan, and the South Bronx for a very long time, the main community-based healthcare location are the city support and connection centers, one being in the Bronx and then one being in East Harlem.
What are the demographics of individuals served by Be Heard over the life of the pilot?
So generally, the demographics of the Be Heard teams that they've been serving have been reflective of the communities that they serve. And as it has expanded, it has continued to reflect the demographics of that community.
Kind of broad answer. Let me leave that one. I'll come back. What type of training is provided by 911 dispatchers regarding mental health calls involving, no, the arm, you answered in that last question. How many hours of training and what types of training do 311 for regarding mental health crisis calls? I think you answered that one too. I don't want you to repeat it. Does Be Heard training involving a trauma-informed framework?
Absolutely. All of the training that we're doing with the Be Heard team involves a trauma-informed framework for both the social workers and for the EMTs. That joint training, that 4 weeks, that is critical to that training.
The council budget response, I'm going to go neighborhood health and ambulatory care centers for the capital. The council budget response called for additional $200 million in capital funding to establish for new H&H neighborhood health ambulatory care centers in communities with poor health outcomes, lacking insufficient access to healthcare facilities. Before I go, I'm going to say 46, we don't have any healthcare center, we don't have no hospital. So I know that, I live it. We do not see that this funding was added. Can you share a bit of your conversation with OMB on expanding healthcare centers in communities that need it most?
We've been clear that we support the creation of additional clinics. I assume that it wasn't included simply because the city's budget has been so impaired by the asylum crisis, that the expenses are so high that it's been difficult for the city to do anything new. And I've certainly heard that the city is not prepared to do anything new right now because of the asylum crisis costs.
I understand, but asylum seekers have a different kind of pool of budget, isn't it? So why does this plan for taking care of the people of the city of New York has to do with asylum seekers? We had the federal funding, we have different paths.
Sure.
Here.
No, I understand. We can raise it with OMB again.
Because New Yorkers, we need the quality healthcare delivery.
Agreed.
And we should not go backward. And the reason that we suffered the most during the pandemic, and you know that as a doctor, and take it from the nurse, is because of the preventive care not taken care of in New York City.
Absolutely.
So how much funding do you have for new facilities?
I think we'd have to follow up specifically. There are no new facilities. We're continuing to work on some of the opportunities that have been identified, but there's no specific funding at this time for new facilities in the capital plan.
I think I'm gonna leave it here. So, yeah, I'm good.
Okay, Dr. Katz, your team, thank you all so much. We look
Thank
forward
you.
to budget negotiations.
And,
Our pleasure. Thank you.
and I do appreciate you, you know that,
We
right?
appreciate
All
you.
right.
All right, we'll take a short break, and then we're going to hear from the Department of Small Business Services.
What does HRA stand for?
Human Resources Administration.
Hello. How are you? So nice to see you. Yes. Okay, that's very helpful. Thank you. We'll get it resolved.
Thank you.
I was a member of CIO. They know that. Very appreciative of you, and thank you for making the statements about the nurses. Because it needs to be part of the city. It can't just be me, or it's not
We
going
need
to
to
happen.
remain our fabric of the city.
People
We cannot
have-
have outsource outside of our city because we want the beauty of the city to continue.
Totally sure. All right, see you both. We're off to. I can take 3 people to the executive.
Yeah, thank you so much.
Linda, you're coming because we're going to the exec. We're going to try to catch the cabinet out of the car. Okay, Patsy can't come, so I can do 3 people.
At one, right? Yeah.
Linda, Deb, so I can take one more person. Who else wants to come? Patsy has the department.
I think we're pulling back. I don't know what they're doing.
Okay, good afternoon. We're now ready to begin the final executive budget hearing of the day. We'll be focused on the Department of Small Business Services, and I'm pleased to be joined by my friend and colleague, Councilmember Julie Menon, Chair of the Committee on Small Business. We've also been joined by Council Members Carr, Ong, and Powers. Welcome, Commissioner Kim and your team. Thank you all for joining us today to answer our questions. Just to set the table, on April 26, 2023, the administration released the Executive Financial Plan for FY23 to 27 with a proposed FY24 budget of $106.7 billion. The proposed FY24 budget for SBS was $197.4 million, and that represents less than 1% of the administration's proposed FY24 budget in the executive plan. This is an increase of $33.2 million, or 20.2% from the initial $164.3 million allocated in the preliminary plan. This net increase is mostly due to additional headcount and other new needs. My questions today will largely focus on items raised in the Council's budget response proposal, as well as the MWBE program, the Small Business Executive Order, the ending of COVID federal aid, and the rising costs on our small businesses. Small businesses are the anchor in every neighborhood of our city. It feels good for politicians to say small businesses are the backbone of our city, but people want to see action and want to see results. And as they move out of struggles with the pandemic, and they continue to be tested by the same spiking rents and other increased costs that we all are. So I look forward to hearing from Commissioner Kim on how we'll support this vital part of the city in the years ahead. I now want to turn to my co-chair for this hearing, Council Member Menon, for her opening statement.
Thank you so much, Chair Brannon. I really want to thank the Chair for his leadership and partnership. And good afternoon, everyone, and welcome to today's budget hearing on small business. My name is Julie Menon. I'm the Chair of the Council's Committee on Small Business Services, and today we'll be hearing from the Department of Small Business Services on their fiscal 2024 executive plan. The fiscal 2024 executive budget for SBS totals $1.97.4 million, with $32 million, or 16.2%, proposed for personal services to support 328 full-time employees. There is a $6.9 million decrease in SBS's fiscal 2023 budget and $33.2 million increase in its fiscal 2024 budget between the preliminary plan and executive plan, primarily from modifications in city funding. SBS's executive budget includes no new needs in fiscal 2023 and $21.3 million in new needs in fiscal 2024. SBS's executive plan includes other adjustments that result in $6 million in reductions in fiscal 2023 and a $14.8 million increase in fiscal 2024. Small businesses are part of what makes New York City attractive and special to so many people around the world. Whether they are born here or from halfway around the globe, the promise of prosperity and earning a living from building a business from the ground up is critically important. We are eager to hear from the agency about how this executive plan is responding to the needs of our small business community. We want to know what the agency's long-term plans are for helping small businesses continue to recover from the pandemic. The fiscal 2023 budget, as of the executive plan, stands at $433.5 million, with $117.4 million coming from federal funds. Federal funds dropped to $43.3 million in the fiscal 2024 as of the executive plan. We would like to learn today what programs have been impacted by the reduction in federal funding. Also, how will the city funding make up for the reduction in federal funding? The Council's budget response included 4 proposals related to the city's small businesses. These proposals called on the administration to add funding to improve access to training and apprenticeship programs, to increase and baseline funding for industrial business services providers, to increase funding to support for MWBEs and entrepreneurs, and lastly, to increase funding to support the formation of new bids. I was disappointed to see that the executive plan did not include funding for any of the Council's proposals. It is the Council's responsibility to ensure that the city's budget is fair, transparent, and accounts for all New Yorkers. This includes equity in funding and assistance. As the chair of the Committee of Small Business, I will continue to push for accountability and accuracy to ensure that the budget reflects the needs and interests of the city's small businesses. I will also continue to push for any funding to support small bids, which has been a top priority of mine, as it is unclear if they were adequately funded in the executive plan. I look forward to an active engagement with the administration over the next few weeks to ensure the fiscal 2024 adopted budget meets the goals of the council has set out. This hearing is a vital part of this process, and I expect that SBS will be responsive to the questions and concerns of council members. I'd like to thank Commissioner Kim for testifying today and his team, and I also want to thank both my staff and the staff of the Finance and Legislative Divisions for their work in preparing this hearing today, specifically Glenn Marcelloni, Julia Haramis, Nicole Kata, Rebecca Barilla, and from my team, Jonathan Shutt, and Brandon Jordan, and Anna Correa. Now, Commissioner Kim, our council will swear you in.
Good afternoon. Raise your right hands, please. Do you affirm that your testimony will be truthful to the best of your knowledge, information, and belief, and you will honestly and faithfully answer council member questions? Kevin Kim? Jackie Malon? Dinah Shell-Gross. Thank you. You may begin.
Good afternoon, Chair Menon, Chair Brannon, and members of the respective committees on small business and finance. My name is Kevin D. Kim, and I am the Commissioner of the New York City Department of Small Business Services, or SBS. Joining me today are SBS's First Deputy Commissioner Jackie Malon and Executive Deputy Commissioner Dinah Shell-Gross, along with members of my senior leadership team. I am pleased to appear before you today to offer my testimony on SBS's fiscal year 2024 executive budget. SBS's fiscal year 24 executive budget is $197.4 million, with a headcount of 328 employees, 22 higher than at the beginning of Mayor Adams' administration. Our budget includes $85.3 million in pass-through funding to other city entities, including the NYC Economic Development Corporation at $44.4 million, NYC Tourism and Conventions at $21.4 million, and Governor's Island at $19.5 million. We serve as a conduit to these entities and thus do not spend or manage any of these funds. SBS's budget is comprised of the remaining $112.1 million, which is allocated to programs and services that connect New Yorkers to good jobs, create stronger businesses, and build thriving, vibrant neighborhoods. We advance this mission daily through the work of our four main divisions: Division of Business Services, or DBS, Division of Economic and Financial Opportunity, or DFO, Workforce Development Division, or WDD, and the Neighborhood Development Division, or NDD. Under Mayor Adams' leadership, and with support from Chair Menon and members of these committees, SBS is proud of its contribution to our city's economic comeback. According to EDC's latest economic report, tourism spending is at 110% of pre-pandemic levels. More than 30,000 new businesses have opened in the last year, and as of April, New York City has recovered 99.7% of private sector jobs, a figure once predicted to take until 2025 or later. As the mayor says often, New York City isn't coming back. We are back. And SBS's fiscal year 24 executive budget includes many important initiatives that will continue to strengthen our economy for years to come. Mayor Eric Adams declared May the first ever NYC Small Business Month, a time to celebrate the over 200,000 New York City small businesses that make our city the greatest in the world. This month, SBS and dozens of city agency and community partners have joined together to produce more than 50 events showcasing our dynamic commercial districts, getting the word out about our free services, and encouraging New Yorkers to shop small and shop local. Small Business Month is a time to also highlight the achievements we have made as a city and as an agency. For example, our DBS division last fall launched our NYC Business Express Service Team, or NYC BEST, to save business owners time and money by providing one-on-one assistance to avoid violations and quickly obtain permits and licenses.
Mayor Adams, Chair Menon, Councilmember Lynn Shulman, and I proudly kicked off Small Business Month by announcing that NYC Best assisted over 2,200 unique businesses to avoid more than $22 million in potential fines and violations in this last year alone. A prime example of an NYC Best success story is that of Lady Cardona, owner and operator of Ladylicious Cakes. As a first-generation Colombian immigrant, Lady began baking at the age of 9. She worked with NYC Best since January to quickly obtain permits and licensing from various agencies to open her wonderful bakery much quicker. Ladylicious Cakes is also one of New York City's more than 10,000 certified minority and women-owned business enterprises, or MWBEs, with whom SBS's DFO division works to connect to government contracting opportunities. In fiscal year 23 to date, SBS certified and recertified more than 2,300 MWBE firms. DFO also works directly with MWBEs to increase their business capacity, access affordable financing, and compete for and win government contracts, leading to a record high city spend with MWBEs of nearly $1.4 billion in fiscal year 22. Of the MWBE firms that won contracts subject to Local Law 1 in fiscal year 22, approximately 3/4 had utilized an SBS service on their path to working with government. In addition, as part of Small Business Month, SBS is hosting an MWBE symposium at our offices today with over 200 MWBEs registered to attend to prepare MWBEs to capitalize on new opportunities provided by the city's recently expanded non-competitive small purchase method. This is just one way we are working with our close partners at the Mayor's Office of Contract Services and the Mayor's Office of MWBEs to achieve Mayor Adams' aggressive goal to award $25 billion in contracts to MWBEs by the end of fiscal year 26. One of the challenges facing businesses today is in recruiting employees. SBS's WDD division works daily to connect New Yorkers to new employment and job training opportunities through our 18 Workforce One career centers. In fiscal year 22, we connected New Yorkers to 25,000 jobs with an average wage of $18 per hour. Already in fiscal year 23, we have served 75,000 New Yorkers with resume help, honing interview skills, and job searches, putting us on track to reach our annual goal of 25,000 job connections once again. We are excited to host a major career fair in the Bronx at Yankee Stadium on May 22nd and invite the council to join us and share our Workforce One resources with your constituents. Our NDD division oversees and guides our network of 76 business improvement districts, or BIDs, which together make up nearly 300 miles of commercial corridors. On May 9th, SBS celebrated the first ever NYC Bid Day to recognize the extraordinary impact of bids on our neighborhoods and commercial corridors. For example, in fiscal year 22, bids collected 4 million trash bags, removed 440,000 instances of graffiti, maintained 176 public spaces, and helped draw over 30 million people into commercial corridors through public events. In fiscal year 23, NDD deployed several new grant programs, including awards of nearly $5.3 million to support the formation of new bids and strengthen the operations of our smaller bids, along with $2 million to lift up merchants associations. We also awarded $3.8 million to 24 community-based development organizations working in low to moderate income neighborhoods through our long-standing programs, Avenue NYC and Neighborhood 360. SBS's fiscal year 24 executive budget furthers our work with bids and community-based development organizations with a $1.5 million expansion of Neighborhood 360 to create new, inventive lighting projects, addressing public safety, quality of life, and drawing visitors to shop and spend in their neighborhoods. At SBS, every month is Small Business Month, and we believe that every day is an opportunity to help more New Yorkers access our free services. Our new agency-wide outreach team has been pounding the pavement to reach over 6,000 New Yorkers in the last year at more than 200 events, including dozens of business roundtables and mobile outreach events. Just last Thursday, our team partnered with the Public Engagement Unit and the Queens Chamber of Commerce to promote our business resiliency services to nearly 300 local businesses. We believe that every dollar a small business spends on a penalty is a dollar that could have been invested in staff or passing along savings to customers. That's why we are pleased to work with Chair Menon and the Council to advance Intro 845, which implements Mayor Adams' Small Business Forward initiative and aims to save small businesses millions per year. We look forward to seeing this effort pass into law. Today, the work of Small Business Forward continues through the development of the New York City Business Portal, a one-stop shop for local entrepreneurs to navigate multiple city agencies as we continue to make New York City a city of yes for small businesses, as well as Mayor Adams' Small Business Advisory Commission. For example, SBAC and SBS recently worked with the Department of Sanitation to ensure a 30-day warning period for businesses and the implementation of the new curbside trash pickup rules. This gave businesses time to prepare and comply with the new standards that will help keep trash off our streets. Last, but certainly not least, earlier this year, SBS successfully rolled out the New York City Small Business Opportunity Fund. The fund, made possible by a historic public-private partnership between the City of New York, Goldman Sachs, and MasterCard Center for Inclusive Growth, as well as 8 Community Development Financial Institutions, or CDFIs, is the single largest public-private loan fund directed to small businesses in the city's history, with a market-leading interest rate of 4%. As a credit to our outreach team, SBS deployed dozens of staff and volunteers going door-to-door to over 500 businesses in less than 2 weeks, including over 100 businesses in the Bronx on the day of the announcement. In closing, we at SBS are dedicated to fulfilling Mayor Adams' clear and bold economic agenda, which is based on equity and inclusivity, and with small businesses leading our recovery. I look forward to our continued partnership with this council and welcome any questions you may have for me or my team. Thank you.
Thank you, Commissioner. What's that? We've also been joined by Councilmember Brewer. I want to ask just quickly about MWBEs since you mentioned it. Could you tell us what percentage of city contracts went to MWBEs last year?
In terms of dollar amounts or in terms of the number of awards?
Number of awards.
So if you look at the local law 1 numbers, it was approximately 1,600 MWBEs that received the awards.
Okay. And I know there was this goal may have changed, but I know there was a goal to reach 30% of MWBEs rewarded with contracts by 2025. Are we still on target for that?
So there was a 10-year goal which of achieving $25 billion in MWBE awards by the year 2025. And we were able to achieve that goal 3 years ahead of time. And we were able to get to that $25 billion, which is why Mayor Adams set a more aggressive goal of achieving $25 billion more dollars by the year 2026, as well as achieving $60 billion in awards by the year 2030.
With regard to the end of the federal funding related to the COVID emergency, how is SBS using the remaining funds in a drawdown so it doesn't negatively impact small businesses?
The COVID funding was instrumental in helping us prop up the emergency services that were needed to help small businesses at the time. Currently, in our fiscal year 24 budget, we will have no program cuts, no reduction of active lines, and so we feel we are very well positioned to continue the work that we've been doing for years on end, but in particular since the start of the Adams administration, to support small businesses, job seekers, and help the commercial corridors thrive.
What loans and grants is SBS currently provided, or what grants are available for small businesses right now?
So the current, right now, if you're talking about the programs in fiscal year 23, the Small Business Opportunity Fund was the signature program that we had. But every day, our capital access team and our Division of Business Services, they work with over 40 CDFI partners to tailor and get access for small businesses to a number of different types of loan products. But in terms of the access of knowledge of knowing what other federal and state grant programs are available anytime they come out, the capital access team at DBS is getting that information out to the small business community.
What's the current funding level for the commercial lease assistance program?
It's $5 million. And what we did was we took what had been a federal program, and we understood how important that was and how much of a need retail stores had for this kind of pro bono legal service. And so we prioritized it and put it into the CTL budget, the executive budget.
What other assistance programs are available for small businesses that are struggling with steep rent increases?
We provide a lot of, I guess the CLA is Commercial Lease Assistance Program is the primary focus because that allows us to get to the small business owners who don't have the legal sophistication to have to go in and negotiate with a landlord who usually is much better equipped with resources to hire attorneys. And so the partnership we have with our nonprofit contracting service to provide that pro bono service has been instrumental in really helping small businesses. Other than that, we've really focused on educating versus punishing small business owners in this administration. So the number of programs, and starting with on day 4 of the administration, as you all probably know, the Executive Order 2, where Mayor Adams said we are going to find ways to either give cure periods, warning periods to small businesses, or to eliminate certain violations that were overly burdensome on small businesses. And that effort, along with Chair Menon, we are looking to save millions of dollars every year for small businesses.
One of the things in the council's budget response was a call to improve access to training and apprenticeship programs. The council called upon the administration to restore $10 million in funding for various SBS workforce development programs. This funding was not included in the executive plan. Do you know why that is?
We have the federal funds to be able to replace most of that and be able to cover the funding that's necessary to continue those programs. In the case of the stipends, for example, we were also, I guess that's not part of this thing, but oh yes, fund stipends. We were able to realign the allocation of the funds over a 3-year period versus all at once, because when people are in job training programs, you kind of need it over time versus it being up in front. So what we did was a combination of using federal funds. We took the opportunity to realign programming and the timing of when the money would be distributed, but there'll be no impact on the programs.
With regard to bids, the council called on the administration to restore the funding for the bids to its FY23 level, providing an additional $5.3 million allocation. That funding was also not added in the executive plan. Do you know why?
We're continuing conversations with OMB on that. The amount of investment that we put into bids in the past year is something that has had a great impact, a beneficial impact, positive impact. We've been able to really highlight the work that they do, as I mentioned in the testimony, through our NYC bid day, which activated 25 bids, which also had 50 bids in total, provide different types of programmings and allow for the general community to plug in as volunteers as part of that NYC bid day. So the work that we're doing, including with the $1.5 million added to do a holiday lighting program, I'm sorry, not holiday lighting, a lighting initiative, is something that we think would also benefit bids for years to come. Just on that lighting initiative, other cities, we looked at models, for example, on Santa Monica Boulevard in West Hollywood, and they were able to create a destination place for the commercial corridor to really feature all of their businesses, and we are looking to replicate some of that here in New York City.
What other cities do you think are doing innovative, something innovative with small businesses?
I think a lot of what we've been doing that's been innovative is coming down the pipeline too with the NYC business portal. That is something that's on track to be rolled out later this year. We think that, again, saving businesses time means saving businesses money, and the way that they'll be able to navigate all of the various city regulatory agencies to get to where they want to be, which is to just be operating their business, that'll be something that the impact of it will be seen later this year and for years to come.
Last question for me. What is the budget that is earmarked for outreach and letting small businesses know that SBS exists?
So that has been a top priority of this administration and a personal top priority of mine. When I came in, I wanted to ensure that historically underserved communities, first of all, knew about all of our services. There was a big push on the language access piece as well. We made it a point to really hit the community, pound the pavement, and within the agency itself, I realigned the structure of the organization to have a dedicated outreach team that we had never had. And through that and the funding as part of the Blueprint Economic Recovery Plan for fiscal year 23, we were able to get all the different ways to get to the community, and the numbers that I had read out in the testimony is one example of it. Another example of it as part of the outreach program has really been to emphasize social media. And if you look at our social media numbers, for example, we've had almost a 900% increase in the video views, which I think is critical because these days the way to get information out isn't always necessarily through the paper press releases. I think that you need to be able to be adaptive, and the social media angle and the push we've made to have people hired solely for focusing on social media has also had a great impact, beneficial impact on our outreach efforts.
I'm going to turn it to Chair Menon. Thank you, Commissioner.
Thank you.
Great, thank you so much, Chair. I just wanted to follow up on what Chair Brandon was asking about MWBEs, because obviously I understand the numbers that you mentioned, but one concern I have is, according to the latest controller's report, Black and Latino-owned small businesses each received under 2% of city contract dollars in fiscal year 22, and only 5% of all new city contracts and purchase orders registered during that same period went to city-certified minority or women-owned business enterprises. So what can we do to try to boost those numbers? And is the problem really outreach, that we're not reaching enough businesses to let them know about this economic opportunity?
I think there's a multi-pronged approach that's needed here. I think the mayor has taken a big step by naming the first ever Chief Business Diversity Officer in Michael Gardner, who brings a wealth of experience from his days at the MTA and SCA successfully running the MWB program. And with him coming on board, it's also been an alignment of MOCS, Mayor's Office of Contract Services, and SBS working closely together to improve the numbers. But I think outreach is a big factor of it, and I think all the things that I just talked about and how we've realigned our organization to focus heavily on outreach to those particular communities that we want to see an improvement of, not just the numbers, but the real improvement in opportunity. I think that'll also be following everything that we've done. On the MWBE side, we've also have the Block Entrepreneurship NYC program at SBS that we've also been looking to engage more. Traditionally, they've been doing entrepreneurship emphasis, but we also understand that once businesses hear about the opportunity, they need to have the proper support for capacity building, the technical assistance, and that's everything that our DFO team is working every day to commit to get done.
Okay, I know you and I have had so many conversations about it, so anything that we can do on the council side, I think working with every council member, having fairs in each council district, making sure that we're including it in our newsletters, giving us the tools we need to be able to communicate that out to our respective districts would be very helpful. You talked earlier about the small business portals. So as you know, earlier last year, the council passed my bill to create this one-stop shop portal. So I'm very curious to hear about any kind of update on when it will be operational, because under the bill, it states that it needs to be operational by November of 2023. So I just want to understand if we're on target and if it's been beta tested.
Sure. We are, as far as I know, we are on track right now for late summer first phase to be rolled out. And by November 2023, we should be able to meet the targets that were laid out in the bill.
And what's the current funding level for this in fiscal 2023, 24, and in the out years?
8.3.
The total funding, we'd have to get back to you because it's a joint project between us and OTI. Our funding is $2 million in the out years, is next year.
Okay, and how is SBS working with the other city agencies who need to be providing data for that portal to truly be effective?
We are working very closely with all of the agencies. They've been very great partners, and we have weekly meetings essentially to ensure that we are all set up to do the data exchanges that will be necessary to aggregate the data in one place.
Okay. In terms of headcount and hiring, so the fiscal 2024 executive plan includes a net increase in headcount of 11 positions since the fiscal 2024 prelim plan. What is going to be the role of the additional staff members?
The agency is organized in a way to effectively do outreach, for example, but I don't think the headcounts correspond directly to any particular agency division at this point.
Okay.
Is it?
Got it.
I'm sorry, could you just?
Yeah, it's budgeted headcount. So we're just trying to get a sense, it's budgeted headcount.
Yeah,
You're asking the additional headcount next year?
Yes.
So most of it is for the Office of Talent and Workforce Development, and then I think there are 3 positions that are associated with the Workforce Development Division on our team.
And how many vacancies do you have right now?
Effectively, since the last time we met, when we had a preliminary budget hearing, we had said we had 67 vacancies, but we've been on a hiring sprint since then, and we have currently 26 people in the pipeline to start working in the next few weeks. Since the last hearing, we've hired and made offers to 37 folks. This week alone, we had 5 new SBSers start. So at this point, we're actively recruiting for the 48 vacancies.
And what's the average period of time that these positions have been vacant?
Yeah, because I think the average time, well, I think since the hiring halls have been instituted, Mayor Adams, DC 37, Henry Garrido, DCAS Commissioner Don Pinnock, I think when they came up with the hiring hall concept, it's been a real help for all the agencies, but in particular ours. I know that citywide it's over 1,000. I think at SBS, we must have at least half a dozen hires through those programs in the last month. So the average has been getting much shorter since all the innovative ways to get people hired.
Okay, if you can just get our respective committees that information, because the concern I have is that, from what I'm hearing, is that these positions have been open for a while. It's not just this agency, it's across all city agencies, and that OMB is taking a long time to get people processed through the system, so we're very interested in getting these positions filled as soon as possible. I want to switch to Cannabis NYC. I have a couple questions about overall the Cannabis NYC and the total funding for this program. If you could speak a little bit about that.
Sure. So we had $4 million in funding for this year. As you know, we launched Cannabis NYC in August of 2022. We aligned it with the state starting to issue the applications for the card licenses. We were able to outreach and touch over 1,000 people interested in applying for that initial set of licenses. We have success stories of people that we've helped to apply and actually get a license as well. I think in terms of the funding, the fiscal year 24, there's going to be $3 million for Cannabis NYC.
And how specifically is the agency assisting small business owners with economic opportunities in this field?
We have a real expert leading Cannabis NYC in our executive director, Dashita Dawson, who comes from the Portland regulatory world. And she has made it a point to outreach to all corners of the city to really focus in on getting the legacy market, understanding the benefits of becoming part of the regulatory legal market, and the outreach through, we've had events through NYCHA partnerships. We've been in a number of schools. I think there's 40 events in the past couple of months that have been organized. There was also the 50th anniversary of the NYC Cannabis Parade that turned out thousands of people. And at those events, we had Moby, our mobile unit, we had our outreach team, we had a lot of volunteers there to give all the information on the emerging opportunity of the cannabis industry.
And what is, in terms of, and I know this is not SBS's chief role and that there are many agencies involved in it, but what is SBS's involvement in helping in terms of the unlicensed smoke shops and making sure that they are not, which they are, completely undercutting the licensed businesses?
I think at SBS and throughout the city agencies, we all understand that for the legal market to be successful, we do have to address the businesses that are operating illegally. California, for example, even after years of being legal in the industry, 75% is reported to be the black market. And so we've learned lessons from other jurisdictions, other attempts at trying to get this right. And so using all those lessons, I know that we're working very closely with the Office of Cannabis Management, which is a state agency, on understanding how we can try to facilitate the legacy market to come and move into the regulatory market.
Okay, before I move to another topic, I want to just acknowledge we've been joined by Councilmember Krishnan, Councilmember Velasquez was just here, Councilmember Stevens, Councilmember Perez, Majority Whip Brooks Powers. I think that is it. Okay. I'm going to move to Center for Workplace Accessibility and Inclusion. So 1.3 million in city funds were budgeted for the disability plan in fiscal 2024. With these funds, SBS will establish a Center for Workplace Accessibility and Inclusion. Can you provide details on this center and the work specifically that it is going to be doing?
That actually initiative is going to be led by the Mayor's Office of Talent and Workforce Development. We'll play a supporting role, I'm sure, as we always do. We work pretty closely with them, but it's really their initiative to lead.
So will SBS be doing, I know you say you're going to be working closely, but will, what specifically then?
I would expect that they would, and we'd be leveraging the Workforce One Career Centers and any of the training programs that we have to aiming at that population, but it's really their initiative.
Okay. On the New York City Small Business Opportunity Loan Fund, so you spoke earlier, Commissioner, about the loan fund, and I was at that announcement. I want to understand it's on temporary pause. So can you talk about why it's on pause? Have the funds been exhausted, and when will it be up and running again?
It's on pause because the demand was great. We wanted to make sure that we could process the people who had submitted their applications to see that the number of applicants could be controlled in a manner so that we don't end up in a situation where you continue to take applications when the money will have been run out. So we are looking to process these, or the CDFI partners that we have, the 8 CDFI partners that we have, are looking to process all the applications that they have as quickly as possible, and looking to distribute the money sometime later, by the end of this year.
So no loans have been disseminated yet, but they are in process?
No, loans have been disseminated, and they continue to be disseminated, but not all the funds have been distributed yet.
And what is the borough breakdown of these loans?
We can get you the information. I don't have the current information right now.
Yeah,
but,
I'd love to see the
yeah.
borough breakdown and council district breakdown.
Sure.
So I have more questions, but I'm going to pause now to have colleagues ask questions. So do you have a list of who? Okay, great.
We're going to start with Councilmember Brooks Powers, followed by Krishna.
Thank you, chairs, and hello, Commissioner and SBS team. First, I'd like to, again, thank you for all of the work that you have been doing in my district, supporting our small businesses. Just a few brief questions. As you know, I have long been an advocate of the MWBEs, and when you were here last during the preliminary budget hearings, I asked you all how you all were prioritizing MWBEs in this year's budget. So does the executive budget provide any further support to MWBEs beyond the allocations made in the preliminary budget? And in our budget response, the council urged the administration to provide $1 million to fund community development financial institutions, also known as CDFIs, to create programs that specifically support underrepresented entrepreneurs. Why wasn't this request for funding accepted by the administration? And then I'll have 2 more questions, but we can start there.
On the question of CDFIs, we share your value in knowing and appreciating how big of a role they play in the community, in their local community, and with specific communities that they often have customer bases that they cater to. That's why when we did the New York City Opportunity Loan Fund, the largest public-private partnership loan fund directed just to small businesses, we intentionally went out of the way to be as inclusive as possible to see which CDFI partners would be involved. And so oftentimes, I think in a situation like this, you can take the 3 or 4 biggest ones and kind of go with it and be done for the day. But we intentionally wanted to make sure that we included a total of 8, which meant that we were expanding out, looking for specific partners that could serve, or that primarily serve particular communities that hadn't had this inclusion previously. And so through that process, we know that the CDFIs will greatly build their capacity and have this exercise of being a part of such a robust and large program. And so through a number of other ways, we work with the CDFIs on a daily basis to try to continue to support their capacity building. And I think through that, as they build capacity, the community benefits the most.
So,
just on the CDFIs, the one other program that we specifically wanted to work with CDFIs is in the MWBE program of Contract Financing Loan Fund, where we loan up to $1 million at 3% to MWBEs who end up getting a contract with one of our city agencies. Oftentimes you find that it's hard enough to get the contract, but once you get the contract, some of the smallest companies are not able to have the capital to even perform on the contract. So we created this program called Contract Financing Loan Fund to up to $1 million upfront money so that they can actually perform on the contract. The contract itself becomes a guarantee of sorts. The CDFI plays a role, again, capacity building. They win, the business wins, and I think the city of New York wins by having this successful program implemented for MWBEs.
Chair, can I ask my last one? Okay, so, excuse me. I also asked last time about the Small Business Residence Fund, which would establish a grant program for MWBEs to assist them to compete in their industry. At the time, the money had yet to be spent. Have those funds been dispersed?
Good afternoon, Council Member, and thank you again for your interest in that program. The funds have not been dispersed. Establishing a grant program for small businesses as opposed to, program for nonprofits is a legally complex and time-consuming process. It requires us to go through a rulemaking process. We did not have sufficient time or the full resources to do that work this year. Generally, we're investing that work when we can establish a grant program, worth several $1 million. So for $75,000, we are looking to repurpose those funds for other purposes in the MWBE program, and we'd be happy to share more details on that as we move forward.
To your point in terms of the resource and what it all will entail, in the fiscal 24 proposed budget, is there any space that the administration is looking to shift funds to help with this fund at all and help to get it disseminated?
I don't believe there's additional funds in FY24 specifically for MWBE grants. As I said, it's a complicated process at any time, to create a grant program for small businesses, especially for small businesses that are potential vendors to the city. But we'd be happy to have further conversation about the needs of MWBEs that could be supported with the grant program and possible ways to secure other sources of funds for those needs.
In that same vein, you all mentioned the last time that you were excited and the city's commitment to MWBEs reflected on the appointment of Michael Gardner. When you look across the executive budget, what do you see as the most important investment in MWBEs that the administration is proposing here, and where could we invest further?
I would say that from the inception of this program in the 90s under Mayor Dinkins, capacity building and technical assistance has been essential. We're attempting to overcome a gap for firms that have been historically excluded from government contracting, and we realize that those exclusions have long-term impacts on those businesses, and we need to give them a helping hand. That's why we're proud and shared the stat that 3/4 of the firms that received contracts in FY22 had benefited from a SBS capacity building service. So we will continue to provide one-on-one technical assistance on individual bids, technical assistance on registering at different levels of government, and I think those technical assistance services will continue to be critical for MWBEs.
Thank you.
Now we have Council Member Krishnan, followed by Brewer.
Well, good afternoon, and thank you, Commissioner, and your team for testifying today and for all your good work and for coming out to my district before, too, to visit some of our immigrant-owned small businesses and talk about language-accessible resources for them as well. I've got a few questions on a couple different topics. My first one is about legal services for small businesses. I know there's the commercial lease assistance program, but I also mean more generally too. One issue that we've been working on, and I appreciate your and SBS's attention to it, is the small business Nepali Bachchangar in Jackson Heights that you visited. That was in the New York Times just last week because they're extraordinarily behind in rent with their landlord, in desperate need of help. And one thing that highlights is the need for more comprehensive legal representation for small businesses in negotiations with landlords. It's just not a level playing field when you don't have it. I obviously come from the civil legal services housing side where we fought hard for a right to counsel, but it's as critical, if not even more urgent now, in the commercial context where that doesn't really exist, and commercial leases are often very one-sided. And then you have situations like with Nepali Bachchangar where they fall really behind in rent and are really subject to displacement, closure, eviction, harassment. And so do you feel that the executive budget currently provides adequate resources for a more robust full representation legal services program? Because I think the brief advice one doesn't go far enough given the magnitude of the crisis here. Do you feel this budget funds those services? And if not, what are the ways in which SBS can work to really expand representation available for small businesses?
Well, thank you, Council Member, for that question. We share your value that it is a tough situation to be in when you're a tenant, a small mom and pop shop that sometimes has language limitations and not really fully understanding the legal system. If you don't have legal representation and you're going up against somebody with more resources who has more experience in the legal representation angle, that's why I think the commercial lease assistance has been such a success and has been one of the most popular programs, and that's why the city has prioritized using city funding once the federal funding is running out on that. And the number of businesses we've been able to work with to help them in these situations has been very impactful. I think that the critical piece to this is that the outreach that we're doing earlier to these businesses before they get into a situation where there's almost a point of no return, when you end up with arrears at a certain level, then the landlord isn't even open to speaking. That's why I think the outreach piece for me is so important, because we want everyone to know earlier on when they're starting to get into a situation where they need the professional help, that they can come to us and we can connect them sooner so that, you know, hopefully you can avoid some more of these situations.
Thank you. I just have two more questions if the chairs will allow. So now switching topics to street vendors. You know, it's a big issue in our city now, and no matter where anyone is on the issue, I think what is indisputable is that the number of both licenses available for street vending is far less than what's needed. And if we had licenses available, and not only that, but a much more simple, less bureaucratic process to get the licenses and access to them, which I know has been a big issue, that would really address concerns as well. So a couple questions I have on this point are, on the education front and the outreach front, does SBS conduct small business services outreach and consultations to street vendors to inform them of city rules and regulations on street vending? If so, can you describe the manner it takes place and how often this educational outreach work is done?
Sure. And thank you for that comment. We agree wholeheartedly at SBS. Street vendors are entrepreneurs, and we provide access to all of our services to street vendors. We all want to work together to, as you said, focus on educating and having compliance on the rules. But at the same time, I think you know, we understand some of the challenges that exist with operating in certain spaces. So our NDD team spends a lot of time working very closely with organizations like the Street Vendor Project. I've personally gone and visited their offices as well and had discussions, and will continue to provide support for street vendors as entrepreneurs so that they can find ways to succeed and you know, feed their families here as well.
And so what support, because I do think that education outreach is really important, and so vendors are aware of the resources available to them. What would you say is the estimated cost to SBS currently of providing educational services to street vendors, and what support and resources would you need to be able to expand that more, to have the staffing to do so?
Yeah, I know at SBS specifically, we've done a mailing over 22,000 street vendors to share all of SBS services. At our business solution centers, there's 7 around the city. We also offer 30-minute pro bono legal clinics and counsel to street vendors. Those are a couple of the examples of programs that we specifically want to target to street vendors.
Do you have a sense of the cost or how much more you would need to really reach the vendors across the city?
I don't. We can try to get that number for you.
Sure, appreciate that. Thank you, Chair Brannan, Chair Menon.
Questions from Councilmember Brewer, followed by Farias.
no longer here.
Okay, we'll go to Councilmember Farias.
Thanks, folks. I wanted to ask some questions around the PEG target and SBS PEGs. Did SBS hit its PEG target this cycle?
Yes, we did.
Okay, great. And will the PEGs reflected in the executive plan for SBS affect the agency's ability to fulfill its mission, and will there be any programmatic input?
No, we are not going to have any program cuts, and we are not getting rid of any active lines. So we will be able to continue to do the great work that our team does to support businesses, job seekers, and neighborhoods.
Great, that's really great to hear. The Business Preparedness and Resiliency Risk Assessment and Grant Program was established in 2015 to help small businesses prepare for emergencies due to severe weather. The executive plan included a PEG of $500,000 in fiscal '24 and $225,000+ in fiscal '25. How were the savings amounts determined, and what impact will the PEG have on BPREP?
Business resiliency program is something that we've been focused on ever since the disasters that the city has encountered over the years. I think business resiliency comes in the form of many ways, but on a basic level, it's if we're able to explain to the business owner something as simple as don't keep all your paperwork, important documents right at your place of work, because if there's a fire, if there's a hurricane flooding, and you lose that with your place of business, then it would cause a lot of challenges when they're trying to get an insurance claim, for example. So it starts as easy as that, but what we've done is we've created a self-assessment tool so that people can do this exercise to understand for their particular business what the vulnerabilities are. And then from there, we bring in a person, an actual person, to be able to go over their specific needs after they've done this self-assessment. And then this program that you're mentioning is allowing for grant money to be available, then to do the next step, which is to address those vulnerabilities and how can you avoid or be in the best position you possibly can if a disaster or an emergency, unexpected emergency were to hit your business.
Okay. The executive plan also includes a funding swap for sustainability training, which replaces city funds with federal funding. In fiscal '24, nearly $900,000 in city funds were swapped out, and in the out years, $1.4 million is swapped. What program or initiative does this relate to, and what is the source of the federal funding?
Hi.
Hi.
The two programs you're mentioning are our Cool Roofs program
Got
and
it.
a building operator supervisor training, and the WIOA is being swapped to support them in the future.
Got it. Chairs, if you don't mind, two last questions.
Councilmember Brewer, do you have questions?
She's giving me her time, if you don't mind.
Sure. Okay. Yeah. Go ahead.
She says the Bronx deserves more time. Just two final, and then Councilmember Brewer can go. The executive plan includes a funding swap for wage adjustment, which replaces city funds with federal funding. In FY24, $665,000+ in city funds are swapped. In fiscal '25, over $440,000 were swapped, and in the out years, a bit over $500,000 were swapped. What exactly does this adjustment relate to? How is it calculated? What is the federal funding source, and why does the amount decrease in the out years?
The swap is, once again, for WIOA, and that those dollars are used to, in general, to fund, in part, our Workforce One career centers.
Got it. Okay. And then I just noticed there's a difference in FY24 in the executive plan between 23 and 24 for the contract services for the Economic Development Corporation. Can you explain those a little bit?
EDC, right?
Yes, it's a pass-through.
That's a pass-through budget item, so the EDC would be able to best answer that.
I will get that from them. Thank you, chairs. Councilmember Brewer?
Thank you, Bronx. So the New York Times had the story the other day about the rent, and it was kind of a strange story. It said rents in other than Manhattan had gone up for commercial storefronts, and Manhattan had not. I don't know that that's correct, but it is an issue. I know that over the last 40 years, SBS has not been able or couldn't deal with the rents. Is that anything that you're thinking about in terms of any programs that you have? People don't want loans, as you know. They want grants or nothing. The rent is the number one issue.
I think the $5 million commitment to our commercial lease assistance program is the primary way we've been trying to help small businesses. And again, trying to get them this information early on instead of when the arrears piles up is something that is critical in our outreach program. And the emphasis on outreach that we've done over the past year hopefully will help alleviate this issue in some way.
The New York Times didn't mention any of that. You know that, right? They didn't say anything that you're doing. Okay. I mean, I still think it's a big problem, despite what you're trying to do. Vacancies. So I've been focused on this. We passed a bill a long time ago stating that the vacancies have to be calculated by finance. But you also have a program that I think Blaze did, the 1.6 million, and then working with XYZ, et cetera. I call it the Blaze program. So I'm wondering where it's at, et cetera, because at least if you know where the vacancies are. Now, when I was just on the phone with the head of the Office of Management, Cannabis Management, and I assume that there'll soon be another 1,400 or 1,500 vacancies within the next few months, because they're on a mission. So then you're going to have more vacancies if they get rid of all the illegals. So just generally, how are we going to deal with vacancies? What can we do to support the owners in that effort? And I would put art, at least put art in the windows, do something.
Yes, the Live XYZ program is, I think, what you're referring to in terms of the program that we are excited to be working with them, and we're waiting for the dashboard to be up and running very shortly, maybe in a month or two. And that's something that the city agencies will all share and be able to identify vacancies in their particular corridors. The bids as well will also have access to that, and they'll be able to continue to partner with us to identify where the greatest vacancies are. Having vacancies is not just an economic issue. We recognize it's a public safety issue, and it is a top priority of this administration to address that. So we look forward to getting that data, and as you said, coming up with solutions to that issue once you know where the vacancies are. I think the nonprofits you mentioned, we've worked with Shashama, for example.
I just put them in a vacant storefront.
Oh,
my
great.
most proud moment. It's fabulous. It's got art, Shoshama, and the vacancy, and people living outside, homeless, graffiti, drugs, all gone.
Wow. I visited one of their locations over at Oculus. They actually have two, and one of them has a collection of, I think, 12 diverse women owners who have different fashion designs all in one little store, and they kind of all hang out there too. And so when somebody comes in to look around, they actually get to talk to the owners themselves, but also get to see such a diverse array of fashion clothing right in a smaller store space. Yeah. And so we've been talking with them and others on how to activate vacant storefronts.
Okay, I totally agree with that. The other thing on bids, I don't know if this is just in my area, but the issue is, very quickly, I assume that if we convert some of these hotels, et cetera, where you have a bid, then you're going to end up with more residential than commercial in terms of the access to funds for the bids. I don't know if that's a citywide issue, but I think it's something to be looked at, because right now, as you know, we don't assess residential, just commercial. And obviously, Lincoln Square with ABC leaving has to think about that. And I just assume I'd love to hear at some point if that's citywide and how we're thinking about it, because I don't want the bids to go away. They do need funding. And what is the new scenario if it is residential more than commercial?
Yes, and we are already talking with the bids on how they can adapt to this, but if we have more of a comprehensive plan, we'll definitely want your input, and we'll share that with you.
Thank you.
Thank you.
Okay, I just have a couple additional areas of questions actually relating to bids, so perfect segue. So as you know, last year I approached the administration to, for the first time, provide direct funding to smaller bids. So I wanted to get an update on where we are with that funding. Was this included in the executive budget, and how many grants specifically were given out?
I know that we've identified all the awardees of the grants that were designed specifically for the bids. I think in terms of whether the money's actually been distributed, as you know, there's a process where the bids would spend the money and then send over the invoicing. So I don't know exactly where we are on that front, but we can get that to you. But the contracts are all signed with the awardees of the money, and we know that this is going to lay a foundation for all the bids, especially the smaller bids that really need the back office kind of basic business support. We're going to ensure that they get what they're getting this time around and really using that as their foundation to be able to launch to a bigger and stronger operation over the years to come.
Great. Yeah, if you could get to both of our committees, which bids received the awards, in what amounts, what is the overall funding, and how much remains in the fund that has not yet been spent, and what are the plans for the unspent funds, that would be great. A different category, there was news recently regarding small businesses fraudulently claiming to be MWBEs. So I wanted to get a sense of what the agency is doing to address this problem.
Thank you, Councilmember Menon. We have a robust audit program. We employ MWBE auditors. They review a certain number of applicants every year. And any case where the majority ownership of the MWBE applicant is narrow, we look at those more closely. The team also conducts site visits on at least 5% of applicants a year. And we investigate any complaint of fraud, whether that is from law enforcement authorities, from other firms in the market. We look closely into the business dealings of those firms. So through those resources, we're guarding against fraud. In an instance like the one that was reported recently, I believe that was regarding the investigation launched by the Manhattan DA. Right. We will look specifically into those firms and consider, whether or not they should continue to be part of the program.
Okay. Neighborhood 360 expansion. So I understand that $1.5 million in city funding was budgeted in the exec plan for the expansion of Neighborhood 360. The purpose of the program is to address needs for lighting improvement in areas, and I know, Commissioner, you spoke about that earlier in your testimony. Can you speak a little bit about how organizations are able to apply for the grants? What is the process, and how many specifically have been awarded?
I think the application period is still open, right? Just closed. It just closed? The application period just closed, and it was a manner by the process which we run through any of our grant programs. People were informed about the opportunity. Organizations could come in and apply for it. The bids knew about it, and it'll be grants of up to $100,000 per year, and the grantees will be responsible for designing, planning, and really marketing the idea of how they would use lighting to be creative to attract businesses or customers and tourists to come to their commercial corridor for the purpose of seeing the lighting, but at the same time, while they're there, take advantage of all the small businesses that are operating in that corridor.
And to make sure we have borough equity and are focusing on under-resourced neighborhoods, can we get a breakdown of where these awards are by borough, by community?
Yes, we'll get that to you.
Okay. My last area of questioning is on federal funding. I know Chair Brandon talked a little bit about this, but I want to understand how the reduction in federal funds is going to impact the agency's programs and performance.
The short answer is it's not. You're talking about like around $65 million between today's budget and next year's. 10 of that is EDC. 30 of that is in the Opportunity Fund. It's a one-time. And 15 or so is in workforce, which is going to come back to us when the WEO budget gets adjusted, because the federal budget is a different calendar than ours, and so it really will have little to no impact.
And does the agency still feel there's a need for federal funding for COVID-related programs?
I mean, I think what has happened was that during COVID, those emergency funds were critical in creating a stopgap for some of the challenges of businesses going out of business at the time. There was a storefront vacancy grant program. There were other programs that were desperately needed at that time. We feel that the economy is getting stronger. It's recovered. I shared some of the numbers before. 1 in 9 businesses that exist today started in the past year. And I think that people are seeing New York City again as a city of yes for small businesses, a land of opportunity. And so I think we're very positive on our outlook of what this next fiscal year looks with the current budget we have.
Okay, those are my last questions. Any last takers?
Commissioner and your team, thank you so much.
Thank you.
Look forward to working with you.
Thank you.
Okay, with that, day 6 of executive budget hearings is adjourned.